mengerikan. Berbicara tentang hal mengerikan, itu bukan sesuatu yang gila, tapi sesuatu yang mampu menyelundup ke dalam tubuh dan menyebabkan tubuh merasa sakit. Seperti virus influenza, Pseudomonas aeruginosa, pneumobacillus, dan bahkan virus lainnya yang mempengaruhi organ dalam tubuh. Oh tidak, pasti Anda berpikir dapat dengan mudah membeli berbagai produk antibakterial dan pembersih dan berpikir semuanya akan baik-baik saja. Namun, apakah kamu sudah benar-benar memahami bahan-bahan yang digunakan? Seringkali kita membeli sanitizer untuk membunuh kuman atau virus. Tapi sanitizer ini mengandung sangat banyak kandungan kimia seperti pengawet, stabilizer, dan banyak lagi lainnya. Menggunakannya secara berlebihan dapat menyebabkan berbagai hal yang negatif, seperti alergi kulit, kanker, dan masih banyak lagi. Wah, mengerikan ya. Jadi, apa yang bisa kita lakukan? Jangan khawatir. Semprotkan disinfektan Eleklin merupakan solusinya. Memperkenalkan Eleklin, musuh dari hal-hal jahat tersebut. Berbeda dari disinfektan atau sanitizer yang beredar di pasaran. Bahan utama yang digunakan pada Eleklin merupakan air. Ya benar, hanya air. Jadi, zat-zat kimia berbahaya yang biasa digunakan pada produk lain di pasaran tidak digunakan pada produk ini. Seperti sulap, bukan? Kalian hanya perlu menambahkan air dan cukup tekan tombolnya. Alat semprot disinfektan terhebat kini telah lahir. Sangat cepat, bukan? Anda bisa bayangkan betapa praktisnya Eleklin. Sebagai tambahan, tidak ada zat adiktif pada air yang dapat menghilangkan resiko yang dapat disebabkan pada sanitizer umumnya. Produk tanpa zat adiktif kimia ini tidak akan membahayakan tubuh Anda. Produk ini juga ekonomis. Jadi, siapa saja yang cocok menggunakan Eleklin? Dokter di rumah sakit, klien hotel, koki di restoran, guru di sekolah, pemadam kebakaran, pebisnis, nenek tua yang tinggal di sebelah, wanita cantik, hewan peliharaan, atau bayi yang baru lahir. Jawaban yang tepat adalah semua orang membutuhkannya. Kami memiliki rujukan ilmiah yang akurat serta grup peneliti yang ahli untuk mendukung kami. Sedangkan mengenai efek sterilisasinya, kami juga didukung oleh beragam sertifikasi. Selama Anda membutuhkan sterilisasi, semprotkan disinfektan Eleklin dapat menggantikan sebagian besar produk disinfektan yang ada di pasaran. Intinya adalah produk ini lebih aman, lebih efektif, ekonomis, dan praktis. Kami persilahkan kepada Anda untuk merasakan sendiri pengalaman terobosan baru ini. Eleklin semprotan disinfektan, semua bersih, semua aman untuk hidup Anda.
ITRI transforms healthcare through AIoT, combining our in-depth knowledge of hospital needs and years of experience of IoMT. We focus on enabling hospitals, care centers, and even individuals to improve their efficiency, optimize operation, and even decrease human errors. Let's look at some of our innovative solutions, shall we? For example, as we gradually move towards paperless hospital, we bring to the vertical market an e-paper display for clinical application. This wall bedside e-paper card is connected to the cloud, linking with your EMR, meaning you can review information that's crucial in your workflow, whilst enhancing patient satisfaction by offering uninterrupted sleep and ease of communication with your inpatients. It's energy saving, less tiring on your eyes, always on, and most importantly, HIPAA compliant. Let's look at the other example. It is known that falls in the elderly are a serious topic. Fall monitoring system is our non-wearable innovation in remote monitoring. Our solution answers exactly to the needs of the aged society to reduce fall and hospitalization, whilst protecting patient privacy. All thanks to the marriage of AI and IoT with the care needs at our core. There are a lot more. Automated dispensing cabinet, smart vital signs station. There's hardly an end to our solution lineup. As a tireless integrator of ICT resources in Taiwan, with the expertise in applying them to healthcare, we, iMedTech, are your ideal partner in smart healthcare.
Di saat seperti ini, imunitas tubuh itu penting banget. Tapi kadang kita lupa, ada yang gak kalah penting, yaitu kesehatan dan imunitas kulit. Karena kulit adalah garda terdepan perlindungan tubuh dari ancaman luar. Padahal ada makhluk yang tak kasat mata yang menjaga kita dari ancaman luar, yaitu microbiome. Wait, micro what? Microbiome. Mereka adalah kumpulan mikroorganisme yang terdiri dari jamur, bakteri, virus, dan archaea yang hidup bareng kita juga loh. Variasi dan keseimbangannya juga berperan membentuk imunitas badan kita. Nggak kelihatan sih, tapi mereka ada di berbagai organ tubuh, seperti sistem pencernaan, lidah, kulit, semuanya deh. Bahkan menurut penelitian, 50% sel tubuh kita adalah microbiome. Lalu apa jadinya ya kalau microbiome kulit kita nggak seimbang? Terus gimana caranya ya supaya microbiome kulit kita seimbang? Makan makanan bernutrisi dan bervariasi, olahraga teratur, meminimalisir penggunaan antibiotik, dan selektif pilih ingredient skincare. Yang paling penting juga, cek kondisi microbiome kulit secara berkala dengan Nusantics Biome Scan. Pastikan kulit kamu sehat dan microbiome kulit kamu seimbang. Yuk cek profil microbiome kulit pertama di Indonesia dengan Nusantics Biome Scan.
Leonardo da Vinci, legendary scholar, artist, and inventor. Could he have imagined modern technology running his inventions on a single device? Every day at ECS, we work on a dream to integrate business departments and offer single-stop technology solutions, bringing boundless mobile possibilities, bleeding-edge smart and IoT solutions, and stunning multimedia entertainment to people's lives in the world. Based in Taiwan, with its eyes to the world, ECS provides comprehensive services across major global cities. 3 decades of technology experience, strong financials, a talented workforce, and a constant drive for innovation and design give ECS a solid lead in a competitive global landscape, receiving international recognition and building deeper customer relations. World-leading equipment and capabilities at ECS's Shenzhen plant provide a manufacturing backbone for motherboards, tablets, laptops, mini-computers, IoT devices, and more. With large investments in our Thailand location, we push the envelope in R&D, manufacturing, and quality control, providing better services to customers worldwide. Integrating 4 business divisions, ECS stays true to its mission, bringing the future within reach. From this same desire, Levo was born, creating breathing space in work environments. Precision computer components are crucial to new technologies. At ECS, we produce independently and as part of major supply chains. In a world of speed, 5G technology stands to redefine fast. Artificial intelligence changes our lives, bringing smart cities closer into reach. New visual realities surround us. Digital displays expand possibilities. Stores can be more. Screens can be more. Controlling access more intelligently, ECS makes your ambitions safer and smarter. In an era of smart solutions, there are better ways to study. With an eye for a greener future, complete smart resource management solutions make the workplace greener and smarter. Time is precious, yet Earth's resources are finite. With cleaner transportation, we can all contribute. As industries navigate volatile markets, ECS helps businesses achieve distribution with fewer hands and more efficiency. Agriculture closely impacts the environment. ECS's unique agricultural solutions help produce food more ecologically, feeding the future more efficiently. Our advanced cloud architecture is the foundation from which we build. As the web connects everything, it brings together technology and humanity. We help you care for the Earth by making smart more simple, preparing you for the world of tomorrow.
Good afternoon, ladies and gentlemen. Welcome to the 2020 Post CoVid-19 Indonesia-Taiwan Forum on Innovative Technology and Bilateral Cooperation. My name is Julia Lonan. I will be your host today. This event today is the cooperations between Industrial Technology Research Institute or ITRI Taiwan and School of Business and Management Institut Teknologi Bandung SBM-ITB. The Industrial Technology Research Institute is technology research and development lab in Taiwan. Founded in 1973, ITRI has played a vital role in transforming Taiwan's industries from labor-intensive into innovation-driven. It focuses on the fields of smart living, quality health, and sustainable environment. Over the years, ITRI has incubated over 270 companies. In addition to its headquarters in Hsinchu City, Taiwan, ITRI has branch offices in US, Europe, and Japan in an effort to extend its R&D scope and promote opportunities for international cooperations around the world. As for SBM-ITB, with the mission to educate students to be innovative leaders with an entrepreneurial mindset and to develop and disseminate knowledge of business and management for the betterment of business, government, and society, School of Business and Management ITB was established on December 31st, 2003. SBM-ITB has a role to be a hub and orchestrator to the development and growth of technopreneur in Indonesia. With the cooperations between ITRI and SBM-ITB, today we will discuss and exchange information on COVID-19 handling and innovation that resulted from this pandemic situation in both countries. This year's event will be conducted using communication technology via the internet, and we hope that you will receive the benefit as much, if not more, from the comfort of your own location. Therefore, to get things started, I would like to introduce to you Professor Utomo Sarjono Putro, Dean of School of Business and Management, Institut Teknologi, Bandung. Professor Utomo received his Bachelor of Engineering from the Department of Industrial Engineering, Institut Teknologi, Bandung in 1992. And in 1995, he graduated from the Master's Program in Decision Science from Tokyo Institute of Technology, and then he continued with his doctoral program also in Decision Science, Department of Value and Decision Science, Tokyo Institute of Technology, Japan in 2001. Right now, I would like to call upon Professor Utomo Sarjono Putro to deliver the opening remark and start off this event. The time is yours, Professor.
To the Honorable Dr. Jack Chang, Deputy General, Director of Industry, Science and Technology, International Strategy Center, ISTI, Industrial Technology Research Institute, ITRI. Mr. Chang Chen Chen, Chief of Industrial Development Bureau, Ministry of Economic Affairs, Taiwan. Dr. Vincent Chen, CEO, Elite Group Computer System Co., Ltd. Dr. Vincent Chen, COO, Elite Group Computer System Co., Ltd. Baron Shah, BDM, Emitech Co., Ltd. Dr. Chin Hang Chen, CEO, Eleclin Co. Chin Liangxi, Technical Sales Manager, ISTI, Industrial Technology Research Institute. Dr. Budi Prawara, Head of Research Center of Electronics and Telecommunications, Indonesian Institute of Science, or LIPI. Ms. Charlini Erisa Putri, Co-founder and CEO of Nusantics Indonesia. Mr. Philip Thomas, Co-founder The Bonsa Indonesia. Dr. Rare Paul Eko Agus Prastio, Head of Management of Technology, Laboratorium, School of Business and Management, Institut Teknologi, Bandung. Distinguished guests, ladies and gentlemen, Assalamualaikum warahmatullahi wabarakatuh. It is an honor and pleasure to be here virtually today with you at the 2020, the new normal post-COVID-19 era, Indonesia, Taiwan Innovation Technology and Cooperation Forum. On behalf of School of Business and Management, Institut Teknologi Bandung, ITB, I welcome all the distinguished speakers and participants to this event. And I am proud that SBM-ITB is selected as one of the partners for co-hosting this prestigious forum with ITRI, which has been renowned as one of the best research institutions in the world. ITB, as a leading technological institution in Indonesia, aims to contribute scientific breakthrough and technological advance by supporting research, innovation, and entrepreneurship that have impacts on society. Our School of Business and Management has a vision to educate students to be innovative leaders with an entrepreneurial mindset and to develop and disseminate knowledge of business and management for the betterment of business, government, and society. In order to accentuate that noble mission, SBM-ITB strongly support the cooperation and building synergy between university, industry, government, and community. In terms of international networks, SBM-ITB has maintained relationship with more than 20 countries across the globe as our global partners and certainly welcomes new cooperation with other international organizations, including Taiwan. We believe that such cooperation will open up new avenues for our students and scholars to learn from one another in terms of culture, economy, business practices, and beyond. The world is full of diversity, and we need to truly appreciate and leverage those differences to foster innovation and create both localized and global solutions. Distinguished guests, we are currently facing the unprecedented issues due to the COVID-19 pandemic which affect all countries across the globe. It is a global public health emergency that requires a global response with far-reaching consequences for our economic and social life. There are many changes in individual lifestyle, business practice, and demand of product and service related to the medical, healthcare, and personal hygiene. However, we should also acknowledge that the next future on the post-COVID-19 era will be likely diverse. We are aware that this problem could not be addressed in silo. We should work together across discipline, sharing and co-create value to contribute and solve the issue. The collaboration between academic, industry, and government is vital to leverage each other's ability and resource to achieve high-quality solutions. SBM-ITB is actively contributing in research and studies since the beginning of the pandemic, such as by conducting study on multi-scenario simulation and modeling to mitigate the spread of COVID-19. Also studying the impact of COVID-19 on the practice of creative business. SBM-ITB is keen on becoming a part of it to leverage the continued process from research and education and nurturing an entrepreneurial spirit, as well as being an active enabler of that process in line with our vision. Distinguished ladies and gentlemen, I would like to thank all the esteemed speakers who are willing to share their insight on sharing the innovation and development of technologies to face a new normal post-COVID-19 era, and also sharing from industries from Indonesia and Taiwan who do a great effort in developing innovative products to help facing the pandemic. I hope that Indonesia and Taiwan can have better insight to keep up in facing post-COVID-19 era. I wish we all have a successful forum from the seminar, and let us continue our partnership and collaboration in the future. Thank you, and wish us have a fruitful discussions today. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you for that very encouraging speech, Professor. Our next speaker is Mr. Jack C. Chang. And before I let you hear what he's going to say, let me introduce you to him. Mr. Chang is the Deputy General Director of Industry, Science and Technology International Strategy Center, or ISTI, Industrial Technology Research Institute, Taiwan. In 1991, Mr. Chang joined Union Chemical Laboratory, or UCL, of ITRI and served as researcher, manager, division deputy director, and director. He then transferred to Industrial Economic and Knowledge Center, or IEK, in 2000 and served as division director and deputy general director. Mr. Jack Chang graduated with PhD in chemical engineering from Louisiana State University. He is a certified senior consultant and Asia Pacific Industrial Analysis Association fellow. His area of research are in petrochemical, biotechnology, renewable energy, cross-strait study, new southbound policy, and technology forecast and foresight. So without further ado, let us welcome Mr. Jack C. Chang.
Okay, thank you, Dean and Professor Petro, for your welcome remark. Good afternoon, ladies and gentlemen. Welcome all of you to virtually join the Post CoVid-19 Indonesia-Taiwan Forum. I'm Jack Chen, Deputy General Director of ISTI ITRI. First, I would like to express my appreciation to our Indonesian partner, School of Business Management, Institut Teknologi, Bandung. It is really a great honor and privilege for ITRI to organize this forum with your esteemed institute. The COVID-19 pandemic brought abrupt challenges to the world. According to the statistics released by Johns Hopkins University, there are more than 35 million confirmed cases and more than 1 million deaths globally as of today. The pandemic forced nations around the world to implement lockdown policies and other preventive measures. This brings changes to the way we live and work. The concept of new normal has attracted attention and interest for all the stakeholders to develop new products and services to satisfy the unmet needs during and after this pandemic. Taiwan is doing pretty well. I think we are very lucky. As of today, we have only less than 600 confirmed cases and single-digit deaths from this pandemic. And therefore, we would like to share our experience with our partners and friends in this forum. We hope that through the exchange of our knowledge and lessons learned from our invited government officers and industry experts, that can help both Indonesia and Taiwan to fight this pandemic better and give all of us a better way to enjoy our life after the pandemic. Finally, I'd like to thank you, all of you, to participate in this forum and wish the best of you and your family. Thank you.
Yes, this pandemic forces nations around the world to implement lockdown policies and other preventive measures. It brings changes to the way we live and work. Therefore, it is important that everybody works together. Thank you, Professor Utomo and Mr. Jack Chang, for the insightful speeches. Next will be the special presentation by Mr. Chung Tian Chen. Mr. Chung Tian Chen is the Chief of Industrial Development Bureau, Ministry of Economic Affairs, Taiwan, and the Chief of Industrial Policy Division. Taiwan's new southbound industry-related policies, including links with Indonesian industries, are all formulated by Mr. Chen's division. And today, Mr. Chen will be talking about experiences of the Mask and Machine Tool National Team Taiwan and the integrations of the epidemic prevention industry supply chain. Let's welcome Mr. Chung Tian Chen.
Hi everyone, especially the friends from Indonesia. I am Chung Tian Chen, the representative from Industry Development Bureau. Today, I'm really glad to share the experiences of the mask and the machine tool national teams and the integration of the epidemic protection industry supply chains. Since the outburst of the COVID-19, Taiwan Center of Disease Control and our high-class medical staff has played a very important role to control the situation. Taiwan has achieved a relatively great controls in the serious pandemic with just more than 500 foreign cases and the single digit of death. Thanks to the determination of our Center of Disease Control and the dedication of our medical staff. You may ask, where is the place for Industry Development Bureau? Actually, Industry Development Bureau teams up the national mask teams to secure the supplies of the personal protection equipment, that is the surgical facial masks. Remember, before February, only 4.58 facial masks per day were available in Taiwan, comparing to the total population of 23 million. That is quite not enough. But within 5 months, in the early May, we expanded the production line to 114, and we together organized to produce 20 million surgical masks per day to meet the citizens' urgent demand. We're proud to show the effectiveness and the efficiency to build up the capacity of the facial mask and the production lines in such short period. That is a very great achievement of our medical equipment suppliers and the machine tool team sectors. After May this year, we contribute surgical masks to all over the world, including Indonesia, to support the medical personnel to fight the COVID-19. Together, Taiwan really can help. And on the other hand, because of the pandemic, the global economy has suffered from the unprecedented impact. According to the statistics, the world GDP growth, trade volume has suffered a huge downfalls. Take the GDP growth, for example. In 2017 and 2018, the world grows at 3% per year. But in 2020, it's expected to decline by 5%. Taiwan relied huge on the trade with the world economy, and to help our business to temper from such a sudden shock, we adopted the economic relief packages to alleviate the situation. First, the salaries of the employees is the most important to support the economy basis. Therefore, we granted the manufacturing and the commercial service sectors the relief loan to help the suffered business to survive. Second, to prevent the business bounce their credit, we also provided loan extension programs to cut down the expense of their operation. Third, we also made the business ready by cutting the operation expenses. For example, their utility bills and expenses, and cutting the rent of industrial park and the scientific park. Beyond that, the relief programs, our industries has seemed to be better and remain strong. And our export has achieved a historical high and ready for the better growth in the 2020. Moreover, our economic relief packages also provide incentives to make a business upgrading their competitiveness by increasing their R&D expenses, by increasing more digitalization, by recruiting more talent, and by stimulating the consumptions. In terms of the on the other hand, in terms of the supply chains, we also propose two major strategies that include the welcome investment, return to Taiwan, and help the Taiwanese companies to adjust their global deployment. Together, Taiwan has shown its resilience in the pandemic, and we group up our national teams to guarantee the supply of personal protection equipment to support our medical personnel. And we really like to share the experience with our friends in Indonesia and to join us. Together, we can make a more great achievement and achieve a better economic growth in the near future. Thank you for our friends. Thank you.
It is indeed a very interesting experience by the Mask and Machine Tool National Team. Thank you for sharing that experience with us, Mr. Chen. Next, we will have our think tank presentation, and this session will be led by Miss Mary Silaban. Miss Mary is an independent business consultant an Indonesian consultant for ITRI. She holds bachelor degree from Department of Geological Engineering, Institut Teknologi Bandung in 2001, and master degree from International Political Economy of Resources from Colorado School of Mines, USA in 2012. She was a journalist for 12 years and has been working in the field of business advocacy, communications, data analytical, and market access in the last 8 years. I would like to welcome Ms. Mary Silaba.
Thank you, Julia, for your kind introduction. Good afternoon, ladies and gentlemen. Selamat sore, Bapak dan Ibu sekalian. We will start this forum with the think tank session, in which we will listen to the innovations made by 2 leading technology labs and think tanks. Representing Indonesia is the School of Business and Management, Institut Teknologi Bandung, SBM-ITB, and representing Taiwan is ITRI. Our first speaker is Dr. Rear Paul Eko Agus Prasetyo. He is the Head of Management of Technology, MOT Laboratory, SBM-ITB. Dr. Eko Agus Prasetyo received his doctoral degree in 2017 from Friedrich Schiller University, Germany. In 2009, he received his master from Nyenrode Business University, the Netherlands, and Kellogg School of Management, Northwestern University, USA. In 1997, he received his Bachelor of Engineering from Institut Teknologi Bandung from the Faculty of Industrial Technology, or FTI-ITB. As you can see on his CV, Dr. Eko Agus Prasetyo also has a range of experience in the field of technology transfer. Without further ado, I would like to invite Dr. Eko to the screen. Dr. Eko, the screen and the microphone is yours.
Hello everyone, my name is Eko Agus Prasetyo. I'm an assistant professor at School of Business and Management, Institut Teknologi Bandung, and I'm also the head of Technology Transfer Division at Institute for Innovation and Entrepreneurship Development, ITB. First of all, I would like to thank you for the invitation to participate in this Indonesia-Taiwan Innovation, Technology and Cooperation Forum. I would like to present how Indonesians keeping up with technologies. Okay, the outline of my talk will be how Indonesians keeping up with technology in terms of using and, more importantly, developing the technology, especially in the most pressing issues today of COVID-19 pandemic crisis. What do we do? What are our responses? And then the consortium and collaboration for research and innovation, and research and technological innovation, as well as commercialization in ITB especially. Now let's take a look at the statistic here. According to the data from World Health Organization, that there are more than almost 300,000 confirmed cases of COVID-19, with more than 10,000 deaths due to this COVID-19 pandemic crisis. And if we take a look at more detailed data of Indonesia per region, we can see that in Java Island, especially in West Java, Jakarta, and East Java, has the most cases. And we have now as much as 4,000, as many as 4,000 cases of COVID per day. So how we respond to this? We have research and innovation for COVID-19 solution. In internal ITB, for example, we received 60 innovation proposals for COVID-19 solution, in which 18 of them are approved. And we have consortium with Ristek BRIN, which is a Ministry of Research and Technology, and LPDP is from Ministry of Finance for the financing, amount of 28 proposals. And from those research and innovation initiative, we produce, like for example, ventilators, like Vent-E and Urgency, and also of Indonesia. This crisis is actually such kind of blessing in disguise for us, because products that previously we just imported from different countries, now we cannot import anymore, and it forced us to do our own research and development, and now we know that we can. Also, ITB have a cooperation, for example, here with Transportation Ministry in doing the research in terms of monitoring and analysis of policy, and also the impact of the pandemic and lockdown policy, also the strategy for new normal balance and how we should cope with that new normal life. Another example here that we have a biopharma, a state-owned company. Also, they develop themselves, for example, for early detection kit of COVID-19. Yeah. Also, plasma therapy for COVID-19 and mobile lab facility, as you can see here. In one occasion, the director of biopharma said that it amazed him how actually we can do even better. We can do a lot in terms of research and development in this crisis situation that might not happen in the business as usual situation. Now, I would like to talk about how, for example, in a university, in an educational institution like ITB, conduct this research and development, yeah, in terms of the technology development. So we have here academic environment. There are study programs and labs where researchers are doing their research and making or developing, having the research results in terms of patents and prototype. And on the other hand, the study programs with the students will result in alumni that would like to be a businessman or a professional. On the other hand, we have industry. Industry, there are banks, venture capital, big company, and consumers. And here we try in LPIK, for example, or Institute for Innovation and Technology Development, try to act as a hub, as an interface to facilitate how this patent and prototype from labs to be commercialized in the industry by making research innovation, facilitating startup, and so on and so forth, and also market access and other roles that allows prototype and patents from the labs and faculties to be translated, to be commercialized into the industry, and have a cooperation with banks, venture capital, big companies, or even direct consumers. The IP management and legal that we have here in ITB, for example, in terms of assessing value creation, securing value to the IPRs, and leveraging or commercializing IPRs. Yeah, so we have been conducting all of these activities. Yeah. And here is the way we are licensing our intellectual properties, especially patents. Yeah. There are inventors and licensee here. The inventors disclose and transfer the IP rights to ITB, and then LPIK as a unit below ITB will take care and facilitate those IP to be registered, to be granted in IPR office, and once it is granted, then LPIK here will facilitate those IP to be licensed to the industry as a licensee here. And this will be the flow of the royalty that will go back to the inventors. We have also the policy of incentive, especially for the inventors that we have here, and according to the type of the intellectual property like patents or copyright or industry design, there will be different kind of incentives. Yeah. How about the innovation ecosystem in ITB? We have innovation ecosystem. If we take a look here, TRL, Technology Readiness Level 1 and 2 until around 3 or 4, we have LPPM, or Research and Community Service Institution in ITB. And in the middle, in the TRL 5 until around 7, we have LPIK, or Institute for Innovation and Entrepreneurship Development. And when the product or the prototype is ready to be commercialized, it will be handled by PT Dika Cipta Inovasi ITB as a business arm of ITB, and eventually the startup will be able to spin out to become an independent startup outside the ITB. So this is the commercialization process. This is just some data to give you an impression about the number of innovation research. This is per year. So we have the increase in the number from 2013 to 2019, and we have patent, number of patent here, but it is the cumulative number. It's not per year. So in total we have more than 300 patents registered and granted. Yeah, the yellow part here is the granted patent, and the blue part here is the registered patent. And here is the number cumulatively of startup business, and here is the innovation product with TRL more than 5, which is the actual or realization, and the blue part here is the target. How about the industry cooperation? Here is just an illustration of the industry cooperation. Like from 2015 to 2019, there is an increasing trend. And also this is about the money, the accumulated budget of innovation research in the billion rupiahs. So 200 billion rupiahs here is around 13 to 14 million US dollars. And we have here some industries that has been cooperating with ITB. So these are the sort of portfolio. Just give you an illustration about some prominent startups from ITB. And if we take a look at the national, even regional level, we have Southeast Asian unicorns. As you can see here, there are 4 unicorns from Indonesia, like Gojek, Tokopedia, Traveloka, and Bukalapak. And the most recent news said that there's one more unicorn. It makes 5 unicorns from Indonesia, which is OVO, which is the fintech company, fintech startup. Also in ITB, in LPIK, we have this innovation entrepreneurship system. It's like a virtual innovation park, and we have this innovation entrepreneurship system, or IES, to support our researchers in registering or managing their patents and other research outputs. We have also actual innovation park in development. We have 2 innovation park, which is Ganesha Innovation Park and Technopolis Innovation Park. Yeah. In 2021, this Ganesha Innovation Park will be done, will be built, will be finished in terms of the development. And this is the co-working space with capacity of around 100 entrepreneurs as a hub for 4 main clusters, which is energy and environment, transportation and infrastructure, ICT, and food and health. And in 2024, we will have even bigger innovation park, which is Technopolis, with 30,000 meters square, and it might have the capacity of 200 startups to be there, and we will invite multinational companies to have office there. And also in this opportunity, I would like to invite also ITRI, for example, to have a representative office in this Ganesha Innovation Park or Technopolis. Why not? Okay, this is just the development progress of the ITB Innovation Park in Ganesha and in Technopolis, with the funding of 48.5 billion rupiahs and more than 500 billion rupiahs in Technopolis with the partners here. Okay, thank you very much for your attention. That will be my presentation, that just giving you impression or illustrations about how we conduct our technological development. Thank you very much again.
Thank you, Dr. Eko, for your presentation. It is very interesting to find out some of the works. I believe there are still many of your works related to the COVID-19 pandemic. Now, I would like to invite Dr. Jack Chang from ITRI Taiwan. As Julia has introduced before, Dr. Jack Chang is Deputy General Director of ITRI Taiwan. At this session, Dr. Chang will present the topic, Medical Innovations and New Service Opportunities in the New Normal. Dr. Jack Chang, the screen and the microphone is yours.
Okay, thank you, Julia, for your kind introduction. I'm going to talk about the medical innovation and the new service opportunities in the new normal. This is the outline of my presentation. As you can see from the chart below, since the outbreak of SARS in 2003 to the COVID-19 in 2020, the emerging time of the large-scale infectious disease is shortened. So the WHO warned us that the pandemic outbreak of fatal disease are becoming a new normal. Through the survey of First Insight, we found out that different generations, they might impact by this pandemic in their lifestyles in different ways. In common, they all show the demand for the increase of internet market or their digital footprint in their life. For example, people shopping more online and shop less in store. Also, we found out most of people are worried about the spread of the virus, as well as when they're receiving product from the most seriously affected areas. Aside from that, different generations may have different opinions on their lifestyle. For example, we can see most of people thinking about cutting back on their spending, but we can see from all those 4 different generations, Generation Z, they cut back. Percentage people cut more than the people in the baby boomer generation. Also, so from all those observations, we think, okay, people will change in their lifestyle or their behavior model in the post-COVID-19 era. And in one word, we can see they were blending of their online and offline work, learning, and life as a whole. For example, you can see people are changing the way in their social interactions. When we see friends, we are not shaking hands or hug each other anymore. We may bump our elbows. So it's a new way to say hello to your friends. And also you can see, okay, people are more adaptable to digital consumption. We will try to blending our work, learning, and life. For example, if you don't need to go to office and work at home, then how are you going to adjust your work and home life balance? Aside from that, people tend to decrease of their group activities, and they will try to use digital more. So on the sales and marketing side, we can see people, they will try to use different methods to buying things. And also, there are change in the mobile behavior. People use less of the public transportation and will use more for private vehicles. As you know, Taiwan is not that seriously affected by the pandemic. So there's a shortage of cars, in new cars in Taiwan right now. So all the dealers are trying to get more cars, okay, from their suppliers. In the next few slides, we are talking about the change in different arena. For example, in business operations, first, I think due to people need to work at home, so most of the enterprises, they will increase their digital technology investment. And aside from that, they are thinking about how are going to increase their resilience in their operation. So they will try to use building up extra capacities and try to create more flexible and transparent way for their supply chain. And also in the marketing and sales part, we see the advancing of omni-channel marketing. For example, people try to use different methods. For example, they will doing digital marketing instead of have some kind of regular advertising campaign as we used before the pandemic. And also we can see the emergence of remote work. For example, Facebook has announced their employee may not need to go to work. Okay, they will be able to work at home maybe for the next 5 to 10 years. And we see more and more companies around the world try to encourage their employee to work at home. Okay, then it will greatly change the way the company operates. So as we see, there is a change in the people's behavior. So for us, we can see that in the post-COVID-19 era, there is a new business model or new way of doing things has been emerging. We call them zero-touch economy and zero-distance innovation. And they are including, for example, the space and time renewal, the ecosystem renovation, the process reformation, as well as service innovation. Then I will make more on each of the points in the next few slides. First, in the space and time renewal. So this is a case of zero-touch innovation. For example, healthcare Institut, they don't encourage their patients to go to the hospital to decrease the risk of being infected. So they try to use so-called telemedicine service. And during that kind of service to avoid the spreading of the pandemic. And for example, in the United States, the Medicare has allowed the insured to use the telemedicine service without incur additional expenses. So for them to help to reduce the chance of being infected by the pandemic. In the process reformation side, we can see, for example, in hospital, before the pandemic, a lot of things was doing by human. But during the pandemic, we can see, for example, in some of the healthcare facility, they adopt more service robots or so-called AGV, autonomous guided vehicle, for example, to send the medical supply or to send the medical records in the hospital or in the facility to lower the labor loading of the healthcare professionals and to increase their competency of the medical staff. For the zero-touch anti-pandemic technology platform has been developed by ITRI. So in ITRI, we try to help the different stakeholders to reduce their risk Okay, for example, in a hospital or in a professional care facilities, we try to develop the so-called 24/7 remote monitoring of the nursing situation room to reduce the risk of infections. That means the nurse can use this system to monitor multiple patients. For example, their vital signs or their activities, okay, without going to to have a close contact of the patients. And finally, for the zero distance innovation, that means we can see, okay, we are physically separated, but we are virtually connected. For example, in this forum, okay, we are not in the same location, but we will be able to communicate with one another, okay, through the internet. Okay, so sometimes we can see, okay, there is more service being provided through the virtual way. For example, you can see digital online traveling. Okay, you don't need to go to the on-site, but you will be able to, for example, using some kind of, for example, AR, VR facilities to make you feel you are there. So there is a new way for us, okay, to enjoy our leisure activities. Okay, so finally, I think we are talking about the service innovation case for zero distance innovation. For example, for some of the people with chronic diseases, they need to go to hospital to be diagnosed, for example, to test on their blood sugars, to see the heart rhythm, or to do a test or diagnosis for them be able to know their status. And then the medical professionals can provide adequate, okay, treatment for those patients. But if you go to hospital during the pandemic, then you will be going to a chance to be affected, okay, in the hospital. So different companies try to develop home test or self-test, okay, ways, okay, for people, okay, for them to do their diagnostic, okay, in home. So we can see different type of product being developed by different companies to satisfy this unmet need. And finally, there is so-called the ecosystem renovation. Okay, in that case, okay, we can see, for example, today, if you are a stroke patient, you must return to hospital for constant rehabilitation, okay, after being discharged from the hospital. But during the pandemic, okay, the patient, okay, rehabilitation treatment, usually they are not encouraging you to go back to the hospital to do that, and they hope you can do it at home or in some other much safer places, for example, in other isolated facilities. Then we can see some companies try to assist those patients to grasp the prime covalence, to give them a more flexible and diversified home care service required to make up for the gap, to let them to do that, okay, in home or in other facilities instead of going back to the hospital. So all those, okay, in whole, we can see that, okay, we have been proposed that through the pandemic, we have developed a different kind of new service or business model to satisfy the unmet need, okay, to solve the problem we are facing nowadays, as well as to improve the core competency of the healthcare or medical industries. And I think through those examples being mentioned in this talk, I think you will have a more feeling about the recent development in these areas, and we are encouraging, okay, all of you to think about it and to participate in the process, and maybe you can develop new product or new services to satisfy the unmet need. Okay, thank you for your attention.
Thank you, Dr. Jack Chang, for your insightful presentation, and also to Dr. Eko Agus Prasetyo. I hope we will see further cooperation between SBM-ITB and ITRI Taiwan. As Dr. Eko mentioned before, SBM-ITB will surely welcomes ITRI to have a local representation. Bapak dan Ibu, ladies and gentlemen, I hope the two presentations entertain your curiosity on what are the breakthroughs and innovation made by these two leading institutions under this season of challenge. Thank you for listening to the presentation. If you have questions, please write down your questions on the provided link, and the speakers will answer your question on the questions and answer session. Now I will return the screen to the MC, Ibu Julia Lonan. Thank you.
Thank you, Ms. Mary, and I hope everyone had benefited from the think tank sessions. At this time, we will give our attention to the Taiwanese companies' presentations, and this session will be moderated once again by Mr. Jack Chang. You may have the stage, Mr. Chang.
Good afternoon. I'd like to introduce the first speaker of the session, Mr. Timothy Huang. Timothy is the Deputy Manager of Business Development in Elite Computer Group Systems. Timothy has more than 10 years of experience in ODM sales, 7 years in MPI project management, and 3+ years in product marketing. Timothy is an expert at data analysis, solution integration, market share analysis, as well as business development. Right now, I'd like to give the podium to Timothy.
Thank you, Dr. Zhang. Since COVID-19 spread to the whole world, everybody is looking for a different solution to sensing the human temperatures, to secure our use. And as experienced motherboard, many computers, and also laptop, hardware computer devices manufacturer, ECS also take a part in this wars. So let's take a look how ECS fight the epidemic through the smart IoT. All right, today I'm going to have a 3 topics. First of all, I would like to introduce my company and then let you know what kind of solutions that ECS can bring to you, and then how we are going to manage our market. First of all, you may know that ECS is a company who make motherboards, computers, and also laptop, pad for more than 30 years. Our headquarters is in Taipei, and employees is around 7,000 more than that and around the world. Okay, this is something you already know. Maybe you have known that in recent decade, we used our design experience to expand our hardware to industrial computers, industrial motherboards, even the IoT devices such like EV chargers, logistics, gateway, something like that. Okay, but something you may not know is now not just the hardware manufacturers, designers, we also provide different solutions under IoT and also smart city. For example, we do have small logistic solutions and smart transportation like EV charging and car park management, and also education, not just the pad and also notebook for students, but a complete solution connection and also softwares. And then, of course, we do have some AI age solutions that I can introduce you later. So, with the topic of COVID-19, I would like to introduce you some solutions for you can reference and you can deploy it in your country or your school enterprises. First of all, for study from home, working from home, or being watching at home, there's 4 different package provided by ECS. First of all, we combined monitors and keyboard, mouse, all the devices to provide you a complete computer set package for you can install at home easily, and using this high performance CPU that you can study through the internet, working from home with web camera very smoothly without any delay. All right, that's the basic package that we can provide to you. Then we're suffering from how to sensing the people's temperature quick and correctly. Now we cooperate with ITRI. They make AI face recognition and also the temperature sensing programs by using our hardware support by Intel Movidius and OpenVINO to make these thermal sensing solutions. And the feature is AI face recognition contactless. It is about 1 to 1.5 meter distance can sense in humans' temperatures, and also it is multiple dynamic measuring, and it's for indoor and outdoor using. This is very good for airport, also the station, hospitals. This is not just a demo case. We do deploy some of about 100 of them in the high school of Taipei. If sensing the human temperature is not able to satisfy you, you may think about when you're wearing the mask, if this solution can work or not. Here is the other one. This solution also cooperates with one of my software companies who write this program to recognize the people's face with face mask on the face, but and also using the high performance mini computers. And as you can see from the screen, even though people wear their mask, we still can measure their temperature and make sure the value of a forehead, and also can identify who they are. Okay. This is a real case that in the building that you can deploy in any entrance and doors to link with your human resource system. All right. Okay, the next one. We are not only provide the solutions, we are also capable to manufacture the medical ventilators. This is technology transfer from ITRI, and we are qualified factory facilities to make this kind of machines. So in the future, if you have any need for such kind of machines, that ECS is able to manufacture these kind of devices for you. Think about some public information you may need to broadcast to anywhere in your countries, maybe to your students or the branch office, something like that. But what kind of devices can satisfy you? There is a solution, easy package that you can install quick and spread the information, important information to the public, to the private. Live digital signage kit include mini computers and also own-made softwares that you can install in Windows 10 easily, and then broadcast all the information to everybody. This service is based on the Microsoft Azure service, so no matter where you are, it is easily to spread all the information. Okay, the application just such like a kiosk, FIDS, Post, or even the traditional digital signage boards. This all the application that this kit can be used. All right, then, with a lot of solutions, there is no way that ECS can cut into the market, because we still need the partners, the dealers, local SI to help us to develop those great solutions to the market. So from the government, to the business, even from the B2B or B2G, we're looking for all the opportunities to cooperate with you. So no matter where you are or who you are, when you are interested in our solutions, please contact us, and we will have our sales people or our local SI distributors to contact you. Thank you, everybody. This is all the solution brought to you by ECS team. Thank you very much.
Leonardo da Vinci, legendary scholar, artist, and inventor. Could he have imagined modern technology running his inventions on a single device? Every day at ECS, we work on a dream to integrate business departments and offer single-stop technology solutions, bringing boundless mobile possibilities, bleeding-edge smart and IoT solutions, and stunning multimedia entertainment to people's lives in the world. Based in Taiwan, with its eyes to the world, ECS provides comprehensive services across major global cities. 3 decades of technology experience, strong financials, a talented workforce, and a constant drive for innovation and design give ECS a solid lead in a competitive global landscape, receiving international recognition and building deeper customer relations. World-leading equipment and capabilities at ECS's Shenzhen plant provide a manufacturing backbone for motherboards, tablets, laptops, mini-computers, IoT devices, and more. With large investments in our Thailand location, we push the envelope in R&D, manufacturing, and quality control, providing better services to customers worldwide. Integrating 4 business divisions, ECS stays true to its mission, bringing the future within reach. From this same desire, Levo was born, creating breathing space in work environments. Precision computer components are crucial to new technologies. At ECS, we produce independently and as part of major supply chains. In a world of speed, 5G technology stands to redefine fast. Artificial intelligence changes our lives, bringing smart cities closer into reach. New visual realities surround us. Digital displays expand possibilities. Stores can be more. Screens can be more. Controlling access more intelligently, ECS makes your ambitions safer and smarter. In an era of smart solutions, there are better ways to study. With an eye for a greener future, complete smart resource management solutions make the workplace greener and smarter. Time is precious, yet Earth's resources are finite. With cleaner transportation, we can all contribute. As industries navigate volatile markets, ECS helps businesses achieve distribution with fewer hands and more efficiency. Agriculture closely impacts the environment. ECS's unique agricultural solutions help produce food more ecologically, feeding the future more efficiently. Our advanced cloud architecture is the foundation from which we build. As the web connects everything, it brings together technology and humanity. We help you care for the earth by making smart more simple, preparing you for the world of tomorrow.
I would like to introduce the second speaker of the session, Mr. Binglong Xie. Mr. Xie received his Master of Science degree in Biomedical Engineering at National Yangming University. He is currently the Business Development Manager of iMedTech, which is committed to building the next generation of integrated care platform with the latest technology. Mr. Xie is in charge of building connection and developing collaboration opportunities in the Southeast Asia region and the rest of the world. I'd like to give the podium to Mr. Xie.
Thank you, Dr. Zhang. Hello, everyone. This is Baron from IMETech Taiwan. And I want to introduce some of the intelligent hospital and smart healthcare solution we have made and we already done in Taiwan, and maybe have the chance to introduce these solutions to abroad, like to Indonesia and there are other countries. Okay, so I will introduce our company first. Why we want to develop the smart healthcare and smart hospital solution? Because actually, you may know in Taiwan, our best students go to the medical school to become doctors, and maybe the second best students will go to the electronic engineering, and we are good at medical and IoT and some other like cell phone, ICT devices. So actually, with this advantage, our company want to combine these two. We want to use our technology and knowledge in IoT and LMP devices and combine with our experience and our training and our good reputation in medical and hospital service. So we want to combine these two, use LMP into medical service to help people, and we will provide a smart healthcare and smart hospital solutions in the hospital. Okay, so that's why we have find out some problems we already see in, I would say, in not only in Southeast Asia, not only in the developing country, but also we have a problem in Taiwan. It means you can see from this slide, many countries in the Southeast Asia and even Taiwan, we have the problem is our hospital is full of too many people, too many patients, and waiting to see the doctors. I would say that is the most problem that everybody didn't want to go to the hospital because we need to wait a lot of time there. And the waiting time, we cannot, we don't know how long is the waiting time. And this is the study we have made in Vietnam. Normally they will need takes 2 hours or even more to see the doctors. So it will become a huge problem, especially in right now in the new normal after the COVID-19. The public area is not easy to get along with each other since we need to cover our mouths, we need to keep a right distance. So in this situation, in the public area, in the hospital, it's a big topic. And so we want to use the smart healthcare, smart solutions, not only to solve the problem with a lot of people waiting in the lobby, but we also want to use this technology to help to increase the efficiency of the hospital, the caregiver in the hospital. So to achieve this goal, the goal is we want to build an intelligent hospital. We have some strategy. This strategy like patient-oriented, of course, operation very efficiently, and still need to be excellence in clinical. So we have several solutions already done in Taiwan, and we will introduce you one by one and to share our experience. And sometimes I want to have a note to say, somebody of you maybe not know what is patient centers. It means actually in the past it's doctor center because you go to the hospital doing what doctor told you to do. So it will refer to the first problem. We didn't know what to do and we didn't know how long we need to wait in the hospital. So right now we want to use technology to change this situation. We want to change the care model, become the patient center, so patient can know and will know what is going to do in this care treatment. Okay, so I will introduce some of the solutions we already done in Taiwan. And the first one we follow to the, you can imagine if you go to the lobby to go to the hospital. So in the past, there are many people waiting, stuck in the public area, waiting to queuing, need to line up to registration. So right now we use a lot of registration kiosk, some queuing broadcasting system. And you can see in the pictures, this is the new counters we have made in Taiwan hospital. So there's some registration kiosk. People can registration by themselves. And there's a lot of queuing, broadcasting signage system to guiding you to where to go and to let every patient to know how many time they need to stay, they need to wait, and how many patients they need to stay. Okay, so actually all the data will become a log. All the log will send back to the system and become a digital data and become big data, so the hospital manager can know how to improve their workflow. And there's some real case we already done in Taiwan, not only in the public space, but also out of the clinic. Okay, the other one is the vital sign kiosk. In the hospital, we need to measure the vital sign. In the past, usually measure the vital sign by themselves. So we developed one kiosk, combine a lot of FDA-approved machine, FDA-approved instrument. So the patient can measure their vital sign by themselves, and all the data was sent to the cloud and to the doctor's computers. So we have some audio and video instruction on this kiosk. So, for example, in Taiwan, we have used Chinese. In US, we made it into English. In Thailand, where they sell this in Thailand, we use in Thai. So, the user can, the patient can use this cast by themselves. And there's some instruction, and all the data will send to the cloud, and even it can be a online to offline platform. It means all the data we can collect and do another application like a promotion or broadcasting. And this one is for the bedside information, patient information display, which replace the traditional paper on the bedhead. So we use the IPC or e-paper terminal, like the picture. So all the information will change automatically. So all the information we will link to the HIS, Hospital Information System. So all the information will send and renew at the right time immediately. So all the information on the display will become the latest. It means there's no medical information error. So you can see the picture is already what we already done in Taiwan. We just installed a whole total hospital with around 500 beds, and all this hospital with this e-paper terminal display. And in the nurse station, all the information not only in the bedhead, but we also send all the information back to the nurse station. So the nurse station will like control centers. So all the nurses in the control centers will know every patient's situation. So one block means one patient. It means if you want to, for example, in this case, if some warning pop out, then the nurse can press and get into this UI, and they will pop out all the information about this patient. So they can get the problem, they can get the information about this patient very quickly. Okay, so we have another several solutions to control the safety. This one is for the medication control automatic dispensing cabinet. So they'll control the registration drug. So in the past, maybe you need to 2 keys to open at the same time, but right now we use the fingerprinting. We use the facial recognition. You can even key in your password. So with this technology, we can identify the right patient, the right people, like doctors, like pharmacists, like a nurse. They have the right and can access this medicine in this in this cabinet. So we can prevent the medication error in this case. Of course, all the information will link to the hospital information system and the pharmacist information system. We'll make sure every prescription is correct, and they can only open the right drawer for the right medicine. And of course, for the new normal, we have other some solutions that can prevent the COVID-19. In this picture, we can see we combine 3 actions, because right now, if we want to go to the Taiwan hospital, in the lobby, we need to check our national insurance card to make sure you never go abroad recently. You need to measure your temperature. You need to have a clean shower or air shower. So we combine these 3 actions into one kiosk. So you can see when the patient or user need to get into the hospital, like this one. This is the real case. We install these stations in the hospital, so they can pass through this gate and measure the temperature, air shower, and distinction display, and some other national insurance card readers. Okay, so in the world, we want to provide better care service quality, so we use this like a TOF, time of flight sensors to prevent the falling or the sensors in this world. So we can see this picture. There's some this sensor is only the black and white information. There's no color image, so it's not a camera. So it's a legal device can install in the world. Okay, so we can use this to detect the patient status in the world. They are lying on the bed, leaving the bed, or even falling down behind the bed. So this is a real case already done in Taiwan. You can see this is a patient with Alzheimer's disease. So this patient is on the bed, so maybe they are going to sleep. So we have a status monitoring to see what is the patient going to do. So actually this is the platform normally the doctor or the nurse didn't need to see this platform. They only see, or maybe they use the indicators when the people is falling or leaving the bed. There's some warning. So with this warning, maybe there's some sound or there's some alerts. They can only focus when there's some alert pop out. So normally they don't need to see this one. But we can still provide this situation immediately. Of course, we already done several activities in worldwide. So there's some case where our solution already installed in the worldwide. Normally, right now, actually, our first international customer is in Thailand and Vietnam, and right now we don't have a Indonesia partner right now. So actually, we are also sharing our experience and what we already done in Taiwan, in Southeast Asia, and we want to introduce our solutions into Indonesia. With you guys, and if you have interesting, you can contact us. And not only this solution I introduced, we have actually we're doing many things in Taiwan. You can see through this picture, and actually our solutions is modular design. With this picture, you can imagine from the lobby going to the outpatient area. There's some broadcasting, curing, kiosk, and vital sign kiosk, and even some interaction projecting media. And in the inpatient area, we have a smart ward, smart nurse station. And this idea can also control like the dialysis room, operation room, and we even have some robot solutions that can help people to clean, to drag out the used instruments. Okay, so we'll show some other real picture we already done in Taiwan. These are some fancy smart ward, curing, and a lot of that, even the robot system. So actually, this is my presentation about what we already done in Taiwan. And in this new normal stage, we want to share our experience and want to maybe find some potential customer. Since the new normal age, we need to use some smarter solutions to help everyone to avoid this COVID-19 virus, and with some smarter and in some IoT devices ways. Okay, so this is my presentation. Thanks for you guys. Thank you.
IMEdTech transforms healthcare through AIoT, combining our in-depth knowledge of hospital needs and years of experience of IoT. We focus on enabling hospitals, care centers, and even individuals to improve their efficiency, optimize operation, and even decrease human errors. Let's look at some of our innovative solutions, shall we? For example, as we gradually move towards paperless hospital, we bring to the vertical market an e-paper display for clinical application. This wall bedside e-paper card is connected to the cloud, linking with your EMR, meaning you can review information that's crucial in your workflow, whilst enhancing patient satisfaction by offering uninterrupted sleep and ease of communication with your inpatients. It's energy saving, less tiring on your eyes, always on, and most importantly, HIPAA compliant. Let's look at the other example. It is known that falls in the elderly are a serious topic. Fall monitoring system is our non-wearable innovation in remote monitoring. Our solution answers exactly to the needs of the aged society to reduce fall and hospitalization, whilst protecting patient privacy. All thanks to the marriage of AI and IoT with the care needs at our core. There are a lot more. Automated dispensing cabinet, smart vital signs station. There's hardly an end to our solution lineup. As a tireless integrator of ICT resources in Taiwan, with the expertise in applying them to healthcare, we, IMEdTech, are your ideal partner in smart healthcare.
Okay, the third speaker of the session is Dr. Jianhong Chen. He is the founder and CEO of Elan Clean. Dr. Chen received his PhD degree from the Institute of Environmental Engineering at National Jiao Tong University. Dr. Chen has 13 years of research experience in water treatment at the MCL of ITRI. Dr. Chen was one of the volunteers in the rescue team to the Southeast Asia area during the 2004 tsunami incident. He was very shocked during that period of time, and he found out that when people were stricken by the natural disaster, there was no clean water to drink. So when he returned to Taiwan, he decided to use his personal experience to develop products that can be purified with a module type to provide refugees with clean and drinkable water, such as Q water. And Elan Clean was founded after to serve the purpose. Aside from that, I think Elan Clean has also decided to develop other products to fulfill their goals to make a better world for both the human society and for the environment. Now we give the podium to Dr. Chen.
Thank you very much, Dr. Zhang. Hello, everybody. My name is Jianhong Chen. I am CEO of ElecClean. I think now, under the COVID-19 epidemic, our lifestyle also have been changed. For example, the mask have become our daily necessary. Besides, the new lifestyle also represent new business opportunity. So that the heroes always occur in troubled times. So the enemy of people are bacteria and virus. However, after several 10,000 years, this problem has not been solved, even become serious. Therefore, we must to think about the lessons that COVID-19 bring to us. So I think until now, last month, the human already death over than 1 million. Hence, the demand of disinfectant increased a lot. According to the New Year's Global Industry Report, it shows the global marketing of disinfectant is US $600 million in 2022, and growth rate over than 11%. And compared to 2019, the growth rate is increasing 23% in 2020. So under that above information, you may be thinking the disinfectant marketing should be very good in the future. That's right, that's correct. The need increased a lot. However, you should be thinking too. Many companies also start into the marketing at the same time. So this situation results in many marketing become more competitive. So and the marketing become red ocean. In this case, is it suitable to into the marketing at the same time? I think my answer is, of course, yes. But we should be think very clearly. Our product or service must be unique, innovation, or different with others. So how to create product different? I think we can consider a technical view, and we can think about what problem of this disinfectant, and how to overcome the disadvantage. In my opinion, I think the safety is most important for disinfectant application. And most companies or most products only focus on the removal bacterial efficiency, but they ignore the safety issue because I think the poison also can kill the bacteria, but I think the safety is more important. However, this table shows the major disinfection technology. I think the first one is the hypochlorite acid. The problem of hypochlorite acid is when the chlorine mixed with organic matter, it will producing make cancer matter. And when the chloride mixed with some acid, when the pH below 4, and the chlorine gas will occur. So it's dangerous and cannot we suck in our body is very dangerous. And the second method, I think everybody know by UV method. But the UV is dangerous. We cannot see the UV light directly by our eyes, and it can. We should to avoid to eradicate on our skin. Also, and the third, I think the ozone. And the problem of ozone is not easy to solve in the water, so that the concentration is quite low, and the ozone is very unstable. And so I think in very few seconds or a few minutes, the ozone concentration will decrease a lot. And for about the electrolyte, I think we are the world first technology to Institut producing the hydrogen peroxide. It's a kind of home appliance. So it can carry out our advantage is more convenience and more economic and more safe. So, and many people always ask me why I have the idea to develop electrolyte. I think the chairman, Dr. Zhang, also already introduced a little. Because when many years ago, when I worked in ITRI, ITRI is the Taiwan largest research institute, and one of my research topics is emergency water treatment. So I developed a Q water, just Dr. Zhang mentioned. The Q water can purify the dirty water into drinking water, so that I join many international disaster relief activity. And I also collaborate with Red Cross, Tzu Chi Foundation. At that time, because of the dirty environment in that area and some remote area, I have allergies and feel uncomfortable. So I just think if we can Institute producing a disinfection in that area, maybe we can solve some problem to help people to avoid getting sick. So that electrolyte, the idea is come from the disaster relief. And electrolyte can turn the tap water into disinfectant directly, so we can increase the water value 100,000 times. And what is the electrolyte mechanism? And electrolyte is an electrochemical system. We develop and mass producing the electrolyte electrodes by ourselves. And under the electrolyte reactor, the water structure can be turned into hydrogen peroxide, hydroxyl radical, superoxide radical. And we call this compound reactive oxygen species, ROS. The ROS can efficiently destroy the activity of virus and bacteria by oxidation method, and the protein structure of virus or the cell membrane of bacteria structure will be destroyed by oxidation. So that's why we can against the COVID-19 by oxidation method. And new life, new appliance is our value, which we want to bring to the whole world, just to develop a different type home appliance. We hope electrolyte can help people more convenience, more safety, and more economic to prevent the epidemic. Now we have 34 international patents, and we have many third-party verification reports of the disinfection report, including H1N1 flu virus and enterovirus, and eyes and skin safety report. And how the electrolyte product to work? Okay. The only resource is water, and under the electroreactor, the water structure can be changed into hydrogen peroxide. And ROS including hydrogen peroxide, and we are not alcohol, we are not include chloride and not ozone, so more safe. And electrolyte is the world first in situ producing hydrogen peroxide home appliance. So we won many international awards like USCS Information Award of Home Appliance, Silver Award of Epidemic Prevention of SNQ, Taiwan Excellent Award, German IF and Japan Good Design Award, and so on. How to use? First step, add water inside. Okay, open the tap and add water inside, and press the button. And after 15 minutes, you can get the ROS disinfectant. You can clean everything. And we can apply electric to clean the cell phone, toilet, and tableware, toys, and so on. And also available for baby and pet. Now we have the 5-type electric home appliance. And like this one is a electric classic, is a portable one. And the water value is 15 milliliter. It can easy to carry and charge by the micro USB here. So that it is very convenient to use any time, anywhere, when you are traveling or out of home. And the second product is Electric Plus, like this one. Is table use in some public field. Water value is 200 milliliter. It can be integrated with an automatic sensor to press out the disinfectant. And the third is share type, okay, like this one. And this function also combined with the NFC function. So we can understand the condition of this electro bottle. And we can know the concentration and using time by our app. And we also develop the electric industrial type, and it can application on apply on the field applications such as chicken farm, pig farm, and agriculture. And finally, Electric 330 can set up in the front door of any building, such as airports, MRT, hotel, school, baby care center, office building, and so on. Therefore, when the people walk into the public place, and the whole body can be clean, and we can avoid the risk of cross infection. And because Electric is very innovative and a practical product for epidemic prevention, so Electric is recommended by many international organizations. Recently, I think it's very important, WHO lists Electric as an innovation technology to against the COVID-19. I think it is Taiwan's honor to let WHO recommend Taiwan original technology, Electric. And we promote Electric and we promote Taiwan original technology to the whole world. So such a good technology, of course, our President Tsai also supporting it. Now, Electric already penetrated 12 countries marketing. We still continue to work hard to expanding our international business. And here, I welcome everybody to cooperate with us. We can collaborate by co-branding or join, develop together by this method. And I think Indonesia is an island-type country, so the transportation is a problem. Hence, in situ producing disinfectant maybe is a very suitable method to prevent the epidemic in Indonesia. So we already have some distributor in Indonesia, and welcome to everybody to contact us. And thank you for kindly attention. Thank you.
Halo semuanya, hari ini mari kita bahas tentang sesuatu yang mengerikan. Berbicara tentang hal mengerikan, itu bukan sesuatu yang gila, tapi sesuatu yang mampu menyelundup ke dalam tubuh dan menyebabkan tubuh merasa sakit. Seperti virus influenza, Pseudomonas aeruginosa, Pneumobacillus, dan bahkan virus lainnya yang mempengaruhi organ dalam tubuh. Oh tidak, pasti Anda berpikir dapat dengan mudah membeli berbagai produk antibakterial dan pembersih dan berpikir semuanya akan baik-baik saja. Namun, apakah kamu sudah benar-benar memahami bahan-bahan yang digunakan? Seringkali kita membeli sanitizer untuk membunuh kuman atau virus. Tapi sanitizer ini mengandung sangat banyak kandungan kimia seperti pengawet, stabilizer, dan banyak lagi lainnya. Menggunakannya secara berlebihan dapat menyebabkan berbagai hal yang negatif, seperti alergi kulit, kanker, dan masih banyak lagi. Wah, mengerikan ya. Jadi, apa yang bisa kita lakukan? Jangan khawatir. Semprotkan disinfektan Eleclean merupakan solusinya. Memperkenalkan Eleclean, musuh dari hal-hal jahat tersebut. Berbeda dari disinfektan atau sanitizer yang beredar di pasaran. Bahan utama yang digunakan pada Eleclean merupakan air. Ya benar, hanya air. Jadi, zat-zat kimia berbahaya yang biasa digunakan pada produk lain di pasaran tidak digunakan pada produk ini. Seperti sulap, bukan? Kalian hanya perlu menambahkan air dan cukup tekan tombolnya. Alat semprot disinfektan terhebat kini telah lahir. Sangat cepat, bukan? Anda bisa bayangkan betapa praktisnya Eleclean. Sebagai tambahan, tidak ada zat adiktif pada air yang dapat menghilangkan resiko yang dapat disebabkan pada sanitizer umumnya. Produk tanpa zat adiktif kimia ini tidak akan membahayakan tubuh Anda. Produk ini juga ekonomis. Jadi, siapa saja yang cocok menggunakan Eleclean? Dokter di rumah sakit, klien hotel, koki di restoran, guru di sekolah, pemadam kebakaran, pebisnis, nenek tua yang tinggal di sebelah, wanita cantik, hewan peliharaan, atau bayi yang baru lahir? Jawaban yang tepat adalah semua orang membutuhkannya. Kami memiliki rujukan ilmiah yang akurat serta grup peneliti yang ahli untuk mendukung kami. Sedangkan mengenai efek sterilisasinya, kami juga didukung oleh beragam sertifikasi. Selama Anda membutuhkan sterilisasi, semprotkan disinfektan Eleclean dapat menggantikan sebagian besar produk disinfektan yang ada di pasaran. Intinya adalah produk ini lebih aman, lebih efektif, ekonomis, dan praktis. Kami persilahkan kepada Anda untuk merasakan sendiri pengalaman terobosan baru ini. Eleclean semprotan disinfektan, semua bersih, semua aman untuk hidup Anda.
For leading us in the insightful presentations by the Taiwanese company, Mr. Jack Chang. Good luck and keep up the good work to all our presenters today. Next will be the Indonesian company's presentations, and this session will be moderated by Ms. Nila A. Windasari, PhD, from School of Business and Management, ITB. Ms. Nila received her bachelor degree in accounting from Universitas Erlangga. After graduation, she worked as an assistant auditor at Mazars. In 2013, Ms. Nila moved to Taiwan and obtained her MBA from Asia University, Taiwan. She got awarded by LPDP to continue her doctoral program in the Institute of Service Science, National Tsinghua University, and during her PhD study, Ms. Nila got an opportunity to do visiting research in Hofstra University, New York, USA. During her study in Taiwan, Ms. Nila also served as tutor for Management Department Indonesia Open University in Taipei for 4 years. She is currently joining sub-interest group Business Strategy and Marketing at SBM-ITB. Her research interests include technology-enabled service, service marketing, and service design to explore how individuals experience technology to improve his or her well-being and concrete value with other actors. To Ms. Nila, the time is yours.
Thank you, Ms. Julia Lonan, for the introductions. Good afternoon, ladies and gentlemen. My name is Nila Windasari, and I am the faculty members at the School of Business and Management, Institut Teknologi Bandung. I am the moderator of these sessions to specifically discuss Indonesian's company presentations, how industries and companies in Indonesia respond and facing the challenge during and post-COVID-19 pandemic era. We know that Indonesia and almost all countries in the world are being affected by COVID-19, but we are also quite optimistic that the industries and corporate can adapt to develop their capabilities to contribute facing the pandemic. Together with us, we have two outstanding companies, Nusantics and the Bonza. Nusantic is a biotech-based innovative company in Indonesia who has developed a genomic startup completed 2 commercial RT-PCR test kits during pandemic. Nusantics already produced 2 locally commercial PCR COVID-19 test kits, and it's already sold and distributed across Indonesia. A very impressive and fast responses actions. So I would like to invite the presenter from Nusantics, the co-founder and CEO of Nusantic, Ms. Charlini Putri. Charlini is scientist, innovator, and business person. Charlini was graduated from Master of Science in Mechanical Engineering, Imperial College London, and Bachelor of Science in Chemical Engineering, Institut Teknologi Bandung. Prior to leading her companies in Nusantic, she was also the Center of Excellence head of Samora Group. Beside her career in industries, she's also actively taking role in some organizational activities, such as Mata Garuda and Low Carbon Future Engineer. Ms. Charlini, please, the time is yours.
Hello, I'm Charlene. I'm the co-founder of Nusantics. Nusantics is an Indonesian genomic startup company. People in Jakarta know Nusantics as a microbiome lifestyle company in which they can come to our hub to get their skin swab in order to check their microbiome profile as well as simple as bacteria and fungal ratio. But during this COVID-19, our B2C business is heavily affected by the pandemic, and that's why we maneuvered by utilizing our R&D in order to produce 2 local commercialized PCR COVID-19 test kits in Indonesia. So I'm very honored to speak in this event, and in this special event, I'm going to tell you the backstory of what and why and how Nusantics do what Nusantics do. Maybe first, Nusantics is founded by 3 Indonesian co-founders with a global mindset. So we know that Indonesia is one of the nations with the highest biodiversity in the world, and we have an underlying question like, in this genomic race, what is our place? What is Indonesian place? Is it going to be solely a place to collect exotic genetic samples, or are we going to be more than that and able to utilize the Indonesian biodiversity at its maximum potentials? So that was our questions within the co-founder 3 years ago. And then we started to think and we considered 3 important factors. The first one is whether the technology is ready, and the second one is whether the market is available, because in Indonesia, we believe that the best thing to change the system is to change within outside the system, and that's why we became entrepreneur. And the third factor is whether the regulation is overly regulated or it is relatively loose for us to make a business. So by considering those 3 important factors, we decided to apply the genomic potential into the beauty market. So as you may know, the beauty market in Indonesia, be it the skincare makeup market or the beauty treatment market such as the beauty clinic, is very huge, and people are crazy about it, and people really want to know more about their skin in order to use the best ingredients they could use. So that's why at first we introduced Nusantics as a B2C business in which people can come, they get their skin swab by using the PCR and the sequencing technology, and then we can give them the profile of their skin microbiome as well as the bacteria and fungal ratio. From that, they will get a recommendation which specific ingredients they should avoid or which specific ingredients will do best for their skin. But then, as our nature of the B2C business is very lifestyle centric, it is affected heavily by the COVID-19 pandemics. So lucky for us, we have a strong relationship, be it inside our team or outside our team with the key stakeholder as well as state-owned enterprises and government. So that's why we decided to repurpose our R&D. So we use our capability in this genomic testing in order to develop the first Indonesian local PCR test kit. So we volunteer to the government, and the government welcome us. So in the 5 months of pandemic in Jakarta, we already produced 2 local commercialized PCR COVID-19 test kit, and it is already sold and distributed across Indonesia. So by this time, we don't know what the futures hold after pandemic in Indonesia. What we believe with optimism that after this we will rise stronger. So we hope this existing capability for Nusantics will be a solid foundation for us, not only to continuing our journey in the B2C business as well, but also for the B2B business, for example, in the area of in vitro diagnostic tests. And we also hope that one day this will only bring us closer to our vision, how genomics can leverage the Indonesia biodiversity potentials. Thank you.
Di saat seperti ini, imunitas tubuh itu penting banget. Tapi kadang kita lupa, ada yang gak kalah penting, yaitu kesehatan dan imunitas kulit. Karena kulit adalah garda terdepan perlindungan tubuh dari ancaman luar. Padahal ada makhluk yang tak kasat mata yang menjaga kita dari ancaman luar, yaitu microbiome. Wait, micro what? Microbiome. Mereka adalah kumpulan mikroorganisme yang terdiri dari jamur, bakteri, virus, dan archaea yang hidup bareng kita juga loh. Variasi dan keseimbangannya juga berperan membentuk imunitas badan kita. Nggak kelihatan sih, tapi mereka ada di berbagai organ tubuh, seperti sistem pencernaan, lidah, kulit, semuanya deh. Bahkan menurut penelitian, 50% sel tubuh kita adalah microbiome. Lalu apa jadinya ya kalau microbiome kulit kita nggak seimbang? Terus gimana caranya ya supaya microbiome kulit kita seimbang? Makan makanan bernutrisi dan bervariasi, olahraga teratur, meminimalisir penggunaan antibiotik, dan selektif pilih ingredient skincare. Yang paling penting juga, cek kondisi microbiome kulit secara berkala dengan Nusantics Biome Scan. Pastikan kulit kamu sehat dan microbiome kulit kamu seimbang. Yuk cek profil microbiome kulit pertama di Indonesia dengan Nusantics Biome Scan.
Thank you, Ms. Charlini, for a very clear and interesting presentations on how Nusantic can provide locally available RT-PCR test kit. Now, we are heading to the second company, which is the Bonza. The Bonza is a big data startup that helps organizations to create a more effective data-driven decision-making. As we know that in the pandemic era, real-time and precise data is the key to create policy and regulations. The Bonza provides dashboard on number of cases on daily basis and help to monitor the cases. The presenter from the Bonza, I will invite Dr. Philip Thomas, the co-founder of the Bonza. He holds PhD in Petroleum Investment and Decisions Analysis in the University of Stavanger. Graduated from Master of Science in Petroleum Engineer from also University of Stavanger. And Bachelor in Petroleum Engineer from Institut Teknologi Bandung. He has a deep career and experience in data science, and he was the data scientist lead in many startups before, such as in Traveloka, Grab, and Kumparan. So, Dr. Philip Thomas, time is yours.
Hey all, thank you for inviting me to share a little bit about the world of data in this event. So my name is Philip Thomas. I'm the co-founder and chief of products and data at Bonza. And Bonza is a data engineering and analytics company, as what we will see today in this event. So I would like to begin my talk with a story of data. In 2017, The Economist published a release about data, and it says that the data is the world's most valuable resources now. And as you can see here, some of the world's largest companies are able to collect large amount of data within their products and turn that data into competitive advantage. And as a result, the world has been shifting, where the top 10 companies in the capital markets used to be dominated by the resource-heavy industries such as oil and gas, is now dominated by the tech companies that use data as their competitive advantage. And this obviously brings a lot of hope to many other companies. They want to go into similar routes, and they also want to turn their data into competitive advantage. And these companies make a lot of investments, implementing a lot of data-driven solutions, deploy their best people to work with data. But the sad truth is, unfortunately, that most of these investments and initiatives fail. And according to many of the surveys from many different sources, say that about 75 to 80% of big data projects fail. And this aren't a new thing. I mean, this number is consistently stay within this range year after year, as the figure shows. And even the latest related figure show that this number is consistently keep being the same despite the advancements in technology. So if you want to increase the success rate of these data-driven projects, we obviously need to redefine the way we execute and design how we do data-driven projects. And that's the reason why we started Bonza. Bonza is a big data engineering and analytics company where our dream is to make every company becoming data-driven organization. Why? It's simply because we believe that becoming data-driven will be the very key for future competitive advantage. It will bring the power of transformation so that every organization can deliver better solutions, release better products, and better adapt to ever-changing nature of the business. But we also acknowledge, as the figure shows, that there are significant barriers, investments required for executing big data solutions. And therefore, we bring new solutions to the market, which is introducing the next generation big data engineering and analytics platform. So we designed our platform so that it can remove friction, enable everyone to work with data, and collaborate so that everyone can collaborate within our platform, whether you are technical users or non-technical users, to deliver data-driven solutions. So Bonza has been very lucky from the beginning. Despite we start our company during COVID-19 period, we are supported by one of the most prominent investors in the region. And our work related to COVID-19 has been published and referenced by a lot of national media that wants to pursue developments related to COVID-19 cases. So, to summarize, Bonza's dream is to empower every organization to become a data-driven organization. We are born and raised in Indonesia with hyperlocal context. Our team is most of them is in Indonesia, and we are scattered across the nation where we work remotely and everyone can collaborate through virtual space. And Indonesia have been our key market since day one. We further strengthen our foundation by through our investors, one of the most prominent investors, and we also partner with one of the largest cloud provider in the region, if not the world. So we put a lot of attention to our users and ensure that they solve problems using our platform. We are driven to make a difference and solve one problem at a time. So that's about ourselves. Now, what about our products? So this is a sneak peek to Bonza Data Platform, where, as you can see, the name of the game is collaboration. So our platform enables collaborative process in executing data engineering and analytics work. So we design our platform such that everyone can deploy data-driven solutions easily and very quickly. Our solutions cover all 5 fundamental steps of bringing data-driven solutions to life. Whether you want to connect your data from many multiple different sources, integrate them, build your solutions, and deploy those solutions and monitoring those solutions, you all can done it in Bonza very easily. So this shows the key feature of our platform. As you can see, we allow connection to any data sources in any format, and that means we need to be scalable, and we are scalable. We can scale, we can process our data in a petabyte scale easily. And despite the capability of our platform, we design it in such a way that everyone, including non-technical users, can author their own data pipelines in user-friendly and intuitive designs. So after you enable these connections, you can also play interactively with the data. Whether you want to clean data, training machine learning models, use our assisted modeling tools, all can be done within our platform within clicks. And after you build these solutions, the next step is to deploy it. And deployment used to be so hard if you are not using our platform, but now our platform automates everything. We bake into the process the best practices, DevOps, and nitty-gritty engineering details so that everyone can deploy solutions within clicks. So we want to show you some of the work related to COVID-19 that have been deployed through our platform. The first is a COVID-19 tracker, where we connect and scrape data from many multiple different sources so that we get data related to COVID-19 from all provinces in Indonesia. Then we deploy a mathematical model, Bayesian-based real-time tracking models that is calibrated to Indonesian-specific cases, where we also automatically handle outliers and other anomalies in the data. And as you can see here, there are many multiple charts from all provinces in Indonesia. And the good thing is that the update is done automatically because we deploy the data pipelines so that there is no more manual process in updating the models. And next, we also would like to bring your attention to work related to socio-economic impact in COVID-19. So again, the first step is to bringing in data from many multiple different sources, which is news and websites in Indonesia. And we bring this data inside our platform, do some natural language processing analysis so that we can gain insights about the socio-economic impact of COVID-19 in Indonesia. So these two shows the examples of what our platform can do, just a glimpse of what our platform can do. Now, our platform can do so much more, and we believe that through our collaborative data engineering and analytics platform, we can enable our clients and users to emerge stronger together during these COVID-19 phases. And we have seen some of the businesses that subscribe to ours, they improve their bottom lines, they streamline their processes, and we have seen the impact of the users of our platform. And because we want to help more businesses, so that we are committed and we will continue perfecting Bonza data platform and reach more users so that everyone can become a data-driven organizations. So this concludes my presentation. Thanks again for the opportunity to share with everyone. I hope this short session is useful for everyone. And thank you, and feel free to ask any question.
Thank you for leading us in the insightful presentations by Indonesian companies, Ms. Nila. Good luck and keep up the good work to all our presenters today. At this time, once again, I would like to call Mr. Jack Chang from ITRI Taiwan to moderate the Technology Institute presentations. Mr. Chang, you may take the stage.
I would like to introduce the first speaker of the session, Mr. Jinliang Xu. Mr. Xu received his Master's of Science in Animal Science from National Zhongxin University in Taiwan. And Mr. Xu has more than 5 years of experience in ITRI to discover innovative partners across Southeast Asia and understanding their unique needs and bridge with the ITRI R&D capabilities to solve great challenges until the technology is ready to commercialize as emerging business. I think the experience Mr. Xu has gathering during the last 5 years with his partners are rewarding, and ITRI welcome more of you to share the same vision and join us in our innovative R&D ecosystem.
Thank you, Jack. So for our distinguished guests from Taiwan, good afternoon. For ladies and gentlemen from Indonesia, selamat sore. I'm Mr. Shi. Today I will be sharing more information about ITRI and also our innovation tech to fight pandemic. So right now, I think most of you heard about ITRI, but today I will give a much more further information, introduction about our organization. We founded in 1973 as a non-government organization and non-profitable organization. We are the Taiwan's largest research institute and also one of the world-leading applied research institutions. We hold 27,000 of patents each year. This is credit to also our staff, which have 6,200 staff, including scientists, engineers, and also researchers. We encourage our personnel to become entrepreneurs when their research is mature and able to commercialize into the market as a business. Another highlight of our organization is we have 18,000 of industrial services cases, not just in Taiwan, but scattered around the world, including Indonesia. So let's see. We focus in 6 domains, which is material and chemical, mechanical and system, information and communications, electronic and operating electronic, green energy and environment, medical device and biomedical device application. So we also need to know the future trend of industrial and also future needs of our user. We need to do the research and analysis as well. So that's why we have a think tank in our organization. Compared with a university, which they all focus on publishing the scientific articles or literature, ITRI, we've tried to fetch this kind of knowledge from the literature to make it into a working prototype or make it into a proof of concept to verify this concept is working or not. Based on this knowledge, we will start the system design or even pilot production from this knowledge and transfer this kind of knowledge to the industry so we can achieve greater beneficial and much more better is to new startup to serve the industry. This is one of our innovation research showcase, which is CVTech's external fermentation tech, which in simple words, we produce kopi luwak without the luwak itself. For our Indonesian friends must know the conventional ways of producing a kopi luwak, which require a lot of labor costs and also the luwak itself. But in Taiwan, we try to simulate the kopi luwak flavor by the machine. We simulate the body digestion fermentation inside the luwak by the machine and create a similar flavor inside our coffee product. So how does this idea come and where does it come from? It actually comes from coffee farmer. However, for them, they don't have any lab or researcher to do the research. They come to ITRI for assistance. In ITRI, we try to study the first stage of the research to prove the concept is working in the machine. And then we start to design the system and upscale to industrial grade for the mass production. And right now, we already tech transfer the technology to the company, and their coffee product already export worldwide. So next time, if you see our product, you can feel free to try. And in this thing, we can confirm that we always welcome for the crazy idea from our partners, and we try to explore more possibility to have the working innovation tech inside ITRI. But innovation alone, we cannot do by ourselves. So we have a lot of representative office around the world, so we can connect with most of the global players. Like we have the office in San Jose, United States. In Europe, we have an office in Netherlands, in Berlin, Germany, and in Russia. And the nearest one is in Japan, Tokyo. So about our international recognition award, we actually named as a top 100 global innovator for the 4th year. And also we have the R&D 100 awards for 13 years. And also we also have the award from CES in Las Vegas for 3 years. So right now, COVID-19 is a global challenge. We should join hands with all sectors to fight this pandemic, especially in ITRI, we protect Taiwan with technology. So I have a short video. We can see what kind of technology we have to protect Taiwan.
工研院提供机械方面的能力跟 电机方面的能力、全力帮我们支持我们，然后才有办法达成这样的任务。
因为有这一台热像仪显示器，可以让我们只要各派一位同仁在这边监看就好了，所以人力上减了将近2/3这么多，所以这台热像仪真的对我们的帮助非常的大。
在这个 App 这个发展出来之后呢，会透过这个 Face ID 或者是 Touch ID 来确认他们的身份，所以这样的问题就解决了。
跟工研合作，2个部分的互补很期盼就是看到这个系统可以早点上市，这不然台湾需要这全世界非常需要这个系统。
工研院这次的这样子的一个裁剪庭的一个研发呢，那事实上提供我们的国家或是我们的医疗院所呢，在接下来或是未来呢，可能的疫情在出现的时候呢，那是一个非常好的一个工具。那么希望呢，这样子的一个裁剪庭呢，那可以在国内呢，那可以做一些广泛的被使用。
呼吸器是一个战略物资啊，尤其是在疫情的时候，呼吸器的制造能力，这个制造能力是真正的国力的。那这个国力对于公共卫生危机的应变是非常重要的。
工研院这一部分的话呢，帮忙非常大，把我们前线跟后线结合在一起。也把我们的病人跟医院跟我们的医生呢结合在一起，原来的这个防疫科技然后甚至于可以扩展到将来的长照科技。
So I think from the video you can have seen a lot of innovation from us, but please let me highlight a few technologies right now for you to have more information about our measurement to protect Taiwan. So right now you can see actually, medical mask is a very fundamental strategic stockpile for every citizen in the country to protect themselves. As individuals, we try to provide as much of the medical mask to each citizen. But you can see that in January 2020, the mask production in Taiwan is only 1.88 million pieces per day. To fulfill the world Taiwan population is far more not enough to fulfill the requirement. So ITRI contribute as one of the core members in mass production line assembly team and boost the production capacity to 20 million pieces per day in 40 days, which means we set up 92 mass production line in 40 days. So you can see that by our expertise and talents inside the photo, they assembly the line as soon as possible and also optimize the production so the production line can reach the maximum production in very short time. Not just the mass production line, we also have our unique formula to produce one of the critical ingredients of medical mask, which is melt-borne fabric. We also do our recipe and produce the melt-borne fabric in Taiwan. So that's why we can help to protect Taiwan from the COVID-19. Another situation we wish to address is the sampling for the medical personnel. From the photo, you can see that this is one of the incidents when the Taiwan medical personnel take the sample from the cruise passenger. And this cruise passenger may be highly infected, so every medical personnel have to wear the protective suit in the outdoor environment, which is hot and humid. So you can see that it is ranging for medical personnel to wear this kind of protection suit. They have to endure the high temperature. Moreover, they have to take 20 to 30 minutes to wear the protective suit, and each suit is cost around 70 to 100 US dollar per set. If today Taiwan have to run the mass testing, so the medical personnel have to wear the protective suit for much longer time and have high risk to contact with the infection. Because of this challenging problem, ITRI has come with a testing booth solution, which ease the personnel and protect them, but also have higher mobility and operate at a reasonable cost. So this is the ITRI positive pressure testing booth, which free the medical personnel from the protection suit. They don't need to wear the protection suit inside the booth. And because of the positive pressure, the air is flow outward. And also inside the booth, it can reach the hygiene level at the clean room class 1000. And the air conditioning is maintained at 25 Celsius, so the medical personnel can work for longer hours. The power consumption is around 2.4 kilowatt, and the maximum sample collecting for this booth is like 240 units per day. So you can see that this is our main actual booth. So the medical personnel can operate inside the booth with the patient to collect the sample. Compared to the photo at the right side, which the medical personnel has worked inside the tent, that is much more convenient compared to, not convenient, much more challenging than working in our booth. Another very challenging thing is happen at the border control, which happen in the airport, where the airport passenger have to queue very long to wait for their testing report. Because right now we are using RT-PCR, require minimum operation samples, and average have to take 2 to 4 hours to know the result. But if the airport do not have the RT-PCR device, the time can take longer because they have to send the sample to the center lab and process with the RT-PCR to know the result. So that's why ITRI has invented an IPMX molecular rapid test system, which is a very small and portable device and able to deliver accuracy up to 90% similar to the device in the center lab to detect the early detection for the COVID-19 infection. So you can see in the photo, this is our actual device. You can hold by the hand, and it is very light. So right now, the main feature is we can deliver the result in 60 minutes, and also you just need to have 6 samples to operate, and the weight is just like 600 grams, but the accuracy is up to 90%. So for those passengers who is in early infection, they do not show any symptom. By this way, we can have a more efficient way to detect how if the passenger is get infected, and for them to get treatment as soon as possible if they detected in the border checkpoint. Not just the border checkpoint, our device can also be deployed at the mobile lab, in the local clinic, or even bring up to a cruise for very high efficient operation. So I think this is all for our technology. And how about our collaboration models? We actually promote a lot of collaboration between the governments or between the organization. We have a lot of models like joint research or even the contract research, or even you can ask us as a consultant to help you to study what is your future direction for your R&D as well. So my friend here, if you have any kind of question or any kind of R&D problem, please feel free to let us know. And this is my contact over there. And also we have a very small QR code at my slide. You can scan for it to subscribe ITRI today to get the latest information for our organization. So I will end my presentation like, ITRI can help. Please let us be your partner. Okay, thank you very much.
I'd like to introduce the second speaker of the session, Dr. Budi Prawara. Dr. Prawara received his Doctor of Engineering degree in Material, Energy, and Structural Engineering from University of the Syracuse in Japan. Dr. Prawara has been serving in different research institutes. Currently, he is the Director of Research Center for Electronics and Telecommunication in LIPI. Dr. Prawara, the podium is yours.
Yeah, thank you very much. Firstly, I would like to thank you for this opportunity to share the current innovation and ongoing research by Indonesian Institute of Sciences regarding prevention and countermeasure of COVID-19. As we know, COVID-19 has been the global pandemic, and according to WHO, it has been infected around 10% of the world. We have to unite and share to overcome the pandemic of COVID-19. Once again, we appreciate the Indonesia-Taiwan Forum that has been organized this seminar. This is the short information about Indonesian Institute of Sciences. We have 32 research centers, and we can divide it into 5 scientific areas. The first is natural sciences, earth sciences, technical sciences, social sciences, and scientific services. We also have 12 technical implementation units and around 1,408 researchers, which are located in 9 provinces in Indonesia. Regarding research and innovation for prevention and countermeasure of COVID-19 in Indonesian Institute of Sciences, actually we have more than 30 research and innovations activity that we can divide it into 7 research and innovations area. The first is Indonesia Herbal for Antiviral, rapid diagnostic tests, medical equipment, whole genome sequencing and vaccine, personal protective and sterilization equipment, information technology, and socio-economy and demography. In this presentation, I am going to present some of research and innovation in the area of Indonesia Herbal for Antiviral, medical equipment, sterilization equipment, and information technology. This is the first clinical trial of herbal products serving COVID-19 in Indonesia, led and designed by Indonesia researchers. There are 2 products that have been clinically tested as immunomodulators, namely Cordyceps militaris and combination of herbal extracts. The combination of herbal extracts consists of red ginger, mandarin leaves, sambiloto, and sembung. The follow-up to the success of this clinical trial is still awaiting the decision of BPOM as the regulator of drugs and food in Indonesia. This is the ongoing research of healthy drink made from fermented red guava, which has been potentially to increase our immunity. The prebiotic supplementation of SCOBY, or symbiotic culture of bacteria and yeast, produce health drink products containing essential amino acids, acetic acid, lactic acid, gluconic acid, glucuronic acid, and other organic compounds. We use red guava fruit to increase the work of body's immune system because guava contains dissolved fiber, polyphenols, alkaloids, and flavonoids. The result of research that have been published have shown that fermentation techniques increase level of antioxidants, polyphenols, and flavonoids higher than ordinary guava juice. This is our innovation in the area of medical equipment. We developed some ventilators. There are 3 types of ventilators that we developed. The first is CPAP BPAP non-invasive ventilations. However, emerging evidence has shown that non-invasive ventilation may have a more significant and positively role than intubation. The current status of our products, now we have 1 prototype of CPAP BPAP non-invasive ventilations and going to test it for calibration for key parameters and critical safety. We also proceed to register the patent, and we have a partner for production, going to the mass production with PT Tesena Indovindo. This product has some advantages. The first is compact design, smart features, easy to operate, and electrical safety according to the IEC 60601. Yeah, this is the CPAP BPAP non-invasive ventilations. This is also a kind of intelligent ventilator. We name C Venetia Smart Innovative Ventilator Indonesia. We can collect the data and the communication protocol by Wi-Fi or Bluetooth. And for the same type of ventilator in hospital, we can mirror it with the control room. So the nurse or the doctor no need to go to the patient room to adjust the parameter or to monitor. Yeah, from the design, we can see that it is very compact, can be transport easily. We can put it on ambulance and also in small rooms. This is the second ventilator that we developed, high flow nasal cannula. And this is the first Indonesian high flow nasal cannula that innovated and created from Indonesia. This product is significant for treat complex respiratory condition who contract COVID-19. This product also has passed for functional tests and endurance tests at BPFK and also has been certified for distribution authorization by Kemenkes. This product also have been using in some hospital to recover COVID-19 patients. The partner for production is PT Garling Utama Mandiri, and they have production capacity until 100 units per month. We also have registered patent for this kind of ventilator. Yeah, for this ventilator, we can adjust some parameter. For example, respiratory flow rate from 30 to 60 liter per minute, and oxygen fraction from 50 to 100%. It is also equipped with heater for humidifier and standard breathing circuit. Yeah, this is the next innovation in the area of information technology, the surveillance system for individual in COVID-19 pandemic situation based on wearable device. Yeah, as we know, there have been many cases of violation of the quarantine regulation for suspects, close contact, confirmed, or positive for COVID-19 individual. As usually in Indonesia, we say as ODP, OTG, or PDP. The several monitoring or tracking application currently being developed still have weakness that cause individual under surveillance to cheat on these devices. So it is necessary to have reliable system that capable of detecting violations, attempts with economically available wearable devices so that it can be implemented on a wide scale. The basic of technology of the wearable device, the wearable device we embedded with Bluetooth low energy chip, which will continue to be attached to the PDP, ODP, or OTG until the isolation or quarantine period is complete. And we can set to have a special ID, and we design so that you can only communicate with the smartphone that is your partner by registering this Bluetooth device on the mobile apps installed on the smartphone. BLE device sends information periodically to the smartphone devices. And in the smartphone, we can install apps that function to register, send information to the server, and check periodically to the Bluetooth device that is their partner. And from the smartphone, we retrieve information periodically from the Bluetooth device, and has a feature to detect violation of quarantine rules. In the application for the supervisor, this is you can see that we can identify the mapping database of individual under surveillance and Bluetooth bracelet IDs. And also, they will be send the notification to the supervisor in the related area if there is a violation of quarantine rules in area, and also if the bracelet is removed by force. Yeah, this is some feature of this wearable device. Because the patient or the individual has been positive COVID-19, they have to use this wearable device for 24 hours. So the battery lifetime is more than 40 days for one time of charge, and the battery is a rechargeable lithium battery and has a range for 20 meters. Then the application based on Android. We have also detection rule violation and affect GPS, and the notification via email and SMS. And also this wearable device is water resistant and secure and keep the privacy. Yeah, this is, you can see when the individual use this wearable device, and this is the display on the cellular. This is the display on the application for the supervisor, and this is the notification when violation of quarantine or isolation occur. For this wearable device, we have industry partner, Peterland Industry Persero. Yeah, the next innovation is Simple Smart UVC Sanitizer. This is a portable room sterilizer using smart UVC light. This light is 254 nanometer. And we have two versions of smart UVC sanitizer. The version 1 has one main lamp, and the version 2 has 6 main lamp. And also we put 3 small UVC lamp in the top of product to sterilize area of top of equipment. Yeah, this product has passed the functional test and also for electrical safety according to ICE 60601. Yeah, this is the multi-purpose autonomous robot that our innovation. So this kind of autonomous robot, we can put some of purpose. For example, we can put it for sterilization, so we can put it the UVC lamp, or we can put mist disinfectant also, and we can put food warmer panel also in one platform. So it is suitable when we use it in hospital. So it will reduce the contact of nurse or doctor to the positive COVID-19 patient or individual. This product has dimensional about 500 by 430 and by 360 millimeter, and has a weight around 22.5 kilogram. This product also has been tested for electrical safety and now going to the productions. I think that's all of my presentations. Thank you very much for your attentions.
Thank you, Mr. Chang. And now we'll open the floor for questions and answering sessions. It has certainly been a very productive afternoon that we are having today. So we are going to start with our question and answering sessions. And right now we have 8 questions that I think we are going to separate with 2 questions each. And I'm going to give a chance for the speaker. All right. So let's start with our questions. Number 1, the first question is from Yanwar Wibisana from PT Indo F. For ECS, Dr. Chen, and IMedTech, Baron Shea, the question is, are your hospital products suitable for premium hospitals only, or can the products be used in lower class or smaller hospitals? That's from Yanwar Wibisana. Before I'm going to let the speakers answer these questions. All right. Second question is from Dasapta Erwin from ITB, and it is for Dr. Jack Chang. And the question is, I would like to know your position about the importance of national level repository to store research results so they are accessible to public. That way people, including industry, could find suitable research for their needs. So these are the 2 questions that I'm going to let the speakers talk about, and I'm going to let Chen or Baron Shea. Well, it is a very, we are going to wait until the speaker is going to answer, and this is the opportunity for everybody to network, to connect with each other. There are so many interests coming from Indonesia for the Taiwan companies, as well as there are questions and interests for the Indonesian companies that are presented today. So I am encouraging you to take this opportunity to network and to ask questions. So let's have Dr. Chen or Baron Shea answer the questions. Are your hospital products suitable for premium hospital only, or can the products be used in lower class or smaller hospital? Okay, Mr. Baron Shea is going to answer these questions, I think.
Great, thanks for your advice. Thanks for your question. So actually, our solutions is, of course, it's not only for the big hospital. And normally, I would suggest that if your hospital size is around 50 beds or more than around 100 beds, this solution is suitable for your application. So, but we still have some other solutions can use for some local clinic or some small hospital they can use. And majorly, we can use some cloud-based platform, so you can share the resource and you will decrease the price. Actually, most of the hospital can use this solution. The difference is, of course, bigger hospital, and they can share the cost about the platform. So my answer is that it depends on your infrastructure, and maybe not only the big hospital, but also the small hospital can use these solutions. Yeah, thanks.
I'm going to let also Dr. Chen to answer the questions, the same questions about the hospital products. From ECS. Well, all right. Unfortunately, we are going to... This is directed to Dr. Jack Chang. I would like to know your position about the importance of national level repository to store research results so they are accessible to public. This is from Dasapta Erwin from ITB.
Okay.
To store research.
Thank you for your questions. Yes. So I think, actually, I think in Taiwan, for all of our research results, okay, there's obligation by the laws that we need to publish all our results, and all the reports are put into the corresponding website of the funding agency. So most of the people who are interested in the outcome will be able to access to that result. So to enhance the cooperation between interest stakeholders. For example, in our organization, ITRI, we are an applied research organization. We do research, file for patent, obtain patent positions, and then we license our technology to local companies commercialization. So for all the IP and the transferable technology are all listed in our website. So companies who are interested to work with us can access to those contents in the website, or they can contact us, okay, by phone or by email, and we are be very happy to contact them for future collaboration. So as you say, I think it is very important that there's a national depository for all the research outcomes, and then for people to access to that. Thank you.
Thank you, Dr. Cheng. The next two questions that I'm going to ask, they are from, one of them is question number 3 and 4. They are from the audience to IMETAC. The question is, how can Indonesian private sectors collaborate with Taiwan's private sectors? That is questions number 3. From Bapak Doni Gumilang, the Investment Coordinating Board, or BKPM, directed to, again, Dr. Jack Chang from ITRI. And the question is, how big the impact of small-medium enterprises to support Taiwan's economy? Is there any specific effort from government or society to support the small-medium enterprise? I'm going to let the questions from one of our audience, question number 3, directed to IMETAC, to be answered first. And the question is, how can Indonesian private sector, so representative from IMETAC, I give you.
Sorry, I didn't hear your question clearly. May I have a list? Can you repeat again?
Questions for IMETAC is, how can Indonesian private sectors collaborate with Taiwan's private sector? And this is especially for your company.
Sorry, actually, I'm not here clearly. So, however, I might introduce not healthcare solution like what we do. Actually, not only for the big government hospital, but also for the private hospital, they can use. So, actually, our goal is how to improve the efficiency and help the people working in the hospital to improve the efficiency, decrease the mistake. So normally, it depends on the procedures of the hospital operations. So there's some regulation like JCI, like other local regulation will force the hospital to promote to running the hospital by some regulation. So sometimes people cannot always follow this regulation because they are going to tire or something like that. So actually, we want to use our IoT technology and our experience in medical service and combine some integrated solutions and use these solutions to help these caregivers, help these workers in hospital to decrease the mistake, to let them have a lot of workloading, something like that. I'm wondering if this can help you to figure out your question or not. Thank you.
Okay, the next questions, thank you very much from IMATAC. And the next questions, again, directed to Dr. Chang. How big the impact of small, medium enterprises to support Taiwan's economy? And is there any specific effort from government or society to support the SME? Please, Dr. Chang.
Okay, thank you for your question. I think in Taiwan, SMEs accounts for maybe more than 98% of the companies in Taiwan. So there are approximately about 1.5 million small and medium-sized companies in Taiwan right now. And since 98% of the companies are SMEs, so it's very important for the for our economy. So under the Minister of Economic Affairs, there is a specific administration called Small and Medium Size Enterprise Administration. They are in charge to assist the local SMEs for their development. So they have a different type of programs to support them for not only in research and development, but also in the area like for the management. For example, in nowadays, during the pandemic, how are going to assist the company to adopt more digital technology and to provide service so they can reduce their contact with the customers to satisfy the unmet need for their customers. And for example, in ITRI, the reason that government funded us because most of the companies are small, medium-sized companies. Most of them, they don't have their own R&D capabilities. So the government funded each maybe around 10 institutions like ITRI in Taiwan. So we develop technology and then we transfer to local SMEs to assist them to develop new products and services. So I think basically that the government do put a lot of attention to assist the local SMEs. And aside from that, I think for the first question, how could Indonesia and Taiwan private company to work with each other? I think each will be very happy to be a bridge. Or I think our partners like ITB, they also, if you are interested, you can contact with them, and then through them, then as a bridge, we can try to work together. Thank you.
Thank you, Dr. Jack. Okay, the next questions is from Mr. Atwir from Indonesia. This is directed to Nusantix. And the question is, how accurate is your PCR skin test? Do you have any further product development plan on the PCR test kit that is more customer friendly, less painful? And then number 7 is from Harki Aprianto and Mr. Effendi, directed again to Dr. Jack. The question is, how can Indonesian researchers collaborate with Taiwan? Is there any plan for Taiwan or ITRI to produce COVID-19 vaccines? Okay, right now I'm going to let representative from Nusantix to answer the questions from Mr. Atwir. How accurate is your PCR skin test, and do you have any further product development plan on the PCR test kit that is more customer friendly, less painful? Nusantix?
Okay, thank you. So may I clarify the question first? So this question is related to the skin test, not the COVID test, right?
First skin test, second
skin. Okay.
PCR test.
Okay. First of all, regarding the PCR skin test, in comparison with other skin microbiology tests, this is the most accurate. And the second one related with the COVID-19 test kit, we are now developing our existing COVID-19 test kit we use on saliva samples. So with hopes that the test kit will be easily accessed by people and they are not required to come into lab and get their nose swab, because people in Indonesia find it very uncomfortable. So that's why now we are developing for the saliva sample base.
Thank you, Nusantix. Right now, I'm going to ask again Dr. Chang to answer these questions. How can Indonesian researchers collaborate with Taiwan? And is there any plan for Taiwan or ITRI to produce COVID-19 vaccine?
Okay, I will answer the second part of the question first. ITRI are not involved in the development of vaccine. But actually, there's a local company called Immune. They are in the process to develop their own COVID-19 vaccine. And from the news, we know they might go into mass production maybe in the middle of next year. So ITRI is not involved in the development of vaccine. And we are very willing to work closely with our Indonesian partners. So I think you can contact us either through email or you can go to our website. And there's an English website of ITRI. So if you are interested, you can contact our Indonesian partner, Institut Teknologi Bandung, and I think they will be more than happy to as a hub, okay, for Indonesia companies to work with us.
All right, thank you, Dr. Chang. Now, the last two questions are from Ridwan Joko, and the first one's directed to Dr. Chen Hung Chen from Eleclean. He said, I've heard about Dr. Chen as the founder of Eleclean that can change water into disinfectant. The question is the disinfectant that is mentioned can kill coronavirus as well? And is there any scientific evidence or lab results that comes with it? Thank you. And the second questions from the audience. You mentioned about potential co-branding. How can we work to collaborate co-branding with Eleclean? This is for the Eleclean representative. And the final questions again directed to Dr. Chin Liang Shi from ISTI ITRI is from Irendra Rajawali. And the question is, it is interesting to hear about your luwak coffee production. I wonder about the possible future collaborations with 74,000 villages in Indonesia to develop their local products. Okay, so I'm going to let Dr. Chen Huang Chen from Eleclean to answer the first two questions from Ridwan Joko, and from the audience. I'm going to repeat the questions again. And the questions is the disinfectant that you produce can kill coronavirus? And is there any scientific evidence or lab results that comes with it? And about the potential co-branding, how can we collaborate to co-brand with EleClean? Please, Dr. Chen. Oh, please unmute, Dr. Chen. We cannot hear you. Please unmute your microphone. Sorry. Hello? Yes? Is Dr. Chen's voice can be heard? Dr. Chen? Dr. Chen Hong Chen from EleClean, can you please unmute your microphone because your voice is not heard yet. Or you can type your answer if your mic having problem. And I will read it for everybody, or everybody can read it in the chat box, I think. While waiting, probably, I'm going to go back to this questions for EleClean a little bit later. Probably we can go ahead with the questions for Dr. Chin Liangshe from ISTI, ITRI, from Irendra Rajawali, and this is regarding the luwak coffee production. It is interesting to hear about your luwak coffee productions, and I wonder about the possible future collaborations with 74,000 villages in Indonesia to develop their local products. I'm going to let Dr. Chin to answer these questions before I'm going back to Dr. Chien from EleClean. Please, Dr. Chin. Can you unmute, please? Yes. Can you unmute? Is his voice heard?
I cannot hear anything.
Okay, good. Okay. Please, Dr. Chin. Yes, we have to bear a little bit with our technicality issues. Sometimes the devil is in the technology. Although with technology, we are enjoying all this information from the comfort of our own location. So can we hear Dr. Chin or Dr. Chien voice?
Hello, hello. Can you hear?
Yes.
Hello, hello. Can you hear?
Yes,
okay.
We can hear right now.
Okay.
Okay. Sorry.
Go ahead,
Sorry,
Dr. Chen.
Technical problem. I just answered 2 questions.
Oh, Dr. Chen. Right now,
Okay.
Dr. Chen?
Okay. Sorry.
Go ahead.
Okay. The first question is about certification. We not only have third-party certification, including the H1N1 and some virus and some bacterial tests, but also we have some text paper to major oxidation capacity method. So in our technology, electrolyte, inside the bottle, we have the electroreactor inside. We're using the oxidation method to transfer the water structure into H2O2, hydrogen peroxide. So that the hydrogen peroxide can damage the cell membrane of bacteria or to deactivate the virus. So we have got a lot of certification and many test paper results. And the second question is what is co-branding? If you want to cooperate with Electrolink, I think you just write an email or call a phone to us. And the co-branding method is very simple. For example, if your branding is Panasonic or some brand name, just we tap in the bottle in our layer, and we just put our Electrolink inside. And so if you want to develop some home appliance, for example, air condition or some dishwasher or some application for toilet cleaning, and we can sell you our electric module, and then you can integrate our module to your system, and then we can create many innovation home appliance. Okay, and thank you.
Co-branding udah. Okay, thank you, Dr. Chen. Now I'm going to let Dr. Chen from ISTI, ITRI, to answer questions about the Luwak coffee productions. Is Dr. Chen's audio available? Okay. Yeah, this is. Oh, this is in regard of the future collaboration with 74,000 villages in Indonesia to develop their local products. Audio, Dr. Chin's audio.
We cannot hear you.
Yes. Dr. Chin's audio is available? Yeah? All right, so while we are trying to figure out how to have Dr. Chin's back with the audio, I have one more question that is directed for LIPI and SBM-ITB, and this is from local business. How can local business partner with LIPI or SBM-ITB to develop your inventions? So I'm going to let either LIPI representative or SBM-ITB to answer the questions. How can local business partner? How can local businesses partner with LIPI and SBM-ITB to develop your inventions? At this time, I'm going to let LIPI or SBM-ITB to answer. Be my guest.
Yeah, maybe I would like to answer the question. Thank you for the questions. In LIPI or Indonesian Institute of Sciences, we have a center for innovation. My center in Bandung, but Center for Innovation in Cibinong. So this Center for Innovation has a task to link between the research center in LIPI and the industry, which is medium or small industry or a big industry. So you can visit our Center for Innovation in Cibinong. And then we have some services for you. For example, we can introduce our research product that already commercialized, or research that have potentially to be commercialized from our research. I think it is similar with ITRI, that we do the research and we have some research product. We apply the patent, then we license this patent to the industry.
Okay, I will also add.
Okay, I'm going to let also SBM-ITB to answer the questions, the same questions. How can local business partner with SBM-ITB to develop your invention?
Okay, thank you very much for the question. Now, I would like to suggest the local business also to cooperate with ITB, not only SBM-ITB, because SBM-ITB is one faculty in ITB, but in ITB level, in the university level, we have also LPIK atau Lembaga Pengembangan Kewirausahaan dan Inovasi. Pengembangan Inovasi dan Kewirausahaan. So we actually are happy to work with local Indonesian businesses in terms of commercializing or let's say developing together products that are potential or prospective to be marketed. Yeah. So now, for example, we are working together with one company to develop together a medical device in a co-development process, and we will have also co-branding between the company and also ITB. So it will be a win-win solution also for the company, because it is endorsed, because we have co-branding, and it's also good for ITB because our invention or technology that's developed at ITB can be commercialized into the market. So I would like to suggest whoever the business, local business is to come to ITB. You can come to SBM-ITB, or you can contact me, for example, to come also to the LPIK or atau LPIK to discuss further about the possibilities of cooperation or partnership in terms of commercializing technologies or products which is potential to be commercialized into the market.
Okay, we will wait for Dr. Shea from ISTI, ITRI to answer our questions. I know we are having a little bit problem with the audio with Dr. Shea. We are hoping that he will come back with us soon so that he can answer the possible future collaboration with villages. You know.
Hello, can everyone hear me?
Coffee. So, is Dr. Shea okay? Dr. Shea, please, you may have the time.
Okay, thank you very much. I'm sorry for the unstable technical problem just now. So regarding the Kopi Luwak solution that developed by ITRI, we actually developed a machine that can simulate the process of the digestion in the luwak. But depends on the luwak and the type of the bacteria inside luwak's stomach. Actually, every places has their own species, so which create different kind of flavor. So regarding your proposal and idea, I think it is a very good thing that we can work together with the Indonesian coffee farmer. So, I would suggest that because we already transfer the technology to one private company in Taiwan, so if any coffee farmer in Indonesia, they wish to expand this kind of collaboration, then please welcome to approach us. We will collaborate together with our technical partner from the private sector and together with the Indonesian farmer to create your own special flavor of the kopi luwak that produced in the artificial way. So I think this is a very good idea to propose.
Thank you, Dr. Shea. And has been a very, very productive question and answer sessions. But unfortunately, we have to end this session at this point. And if you have any more question, concern, or if you have further cooperations, questions, you may contact the ITRI or SBM-ITB for any further collaboration and cooperations. So with that, let's continue with our final events. Unfortunately, that was all the time we had this afternoon, and it is truly a wonderful opportunity for discussion and information exchange. And to conclude our event today, I would like to call upon, once again, Dr. Jack Chang of ITRI Taiwan to deliver the closing remark. Dr. Chang, this is your time.
Okay, in closing, first I'd like to thank all the moderators and speakers who have joined the forum and to make this a reality. For all the speakers, they've shared experience about how to fight the pandemic and make the world better again. And finally, I would like to thank our Indonesian partner, School of Business Management of the Institut, Teknologi, Bandung. So I do appreciate your efforts to host and organize this forum with us, and I hope this is the beginning of a long-term cooperation. Thank you all. Thank you.
Ladies and gentlemen, we have great challenges and great opportunities ahead of us, and with the opportunity presented and the cooperations we are making, we will meet those challenges and opportunities and make this next year the best year in our history. On behalf of the Industrial Technology Research Institute Taiwan and School of Business and Management Institut Teknologi Bandung, we hope that all of you who participate today will benefit tremendously from the exchange of information and the networking opportunity. I sincerely thank you for your time, enthusiasm, and participation in this 2020 Post COVID-19 Indonesia-Taiwan Forum on Innovative Technology and Bilateral Cooperation. Have a wonderful rest of the year to everyone. Goodbye.
hari ini mari kita bahas tentang sesuatu yang mengerikan. Berbicara tentang hal mengerikan, itu bukan sesuatu yang gila, tapi sesuatu yang mampu menyelundup ke dalam tubuh dan menyebabkan tubuh merasa sakit. Seperti virus influenza, Pseudomonas aeruginosa, Pneumobacillus, dan bahkan virus lainnya yang mempengaruhi organ dalam tubuh. Oh tidak, pasti Anda berpikir dapat dengan mudah membeli berbagai produk antibakterial dan pembersih dan berpikir semuanya akan baik-baik saja. Namun, apakah kamu sudah benar-benar memahami bahan-bahan yang digunakan? Seringkali kita membeli sanitizer untuk membunuh kuman atau virus. Tapi sanitizer ini mengandung sangat banyak kandungan kimia seperti pengawet, stabilizer, dan banyak lagi lainnya. Menggunakannya secara berlebihan dapat menyebabkan berbagai hal yang negatif, seperti alergi kulit, kanker, dan masih banyak lagi. Wah, mengerikan ya. Jadi, apa yang bisa kita lakukan? Jangan khawatir. Semprotkan disinfektan Eleclean merupakan solusinya. Memperkenalkan Eleclean, musuh dari hal-hal jahat tersebut. Berbeda dari disinfektan atau sanitizer yang beredar di pasaran. Bahan utama yang digunakan pada Eleclean merupakan air. Ya benar, hanya air. Jadi, zat-zat kimia berbahaya yang biasa digunakan pada produk lain di pasaran tidak digunakan pada produk ini. Seperti sulap, bukan? Kalian hanya perlu menambahkan air dan cukup tekan tombolnya. Alat semprot disinfektan terhebat kini telah lahir. Sangat cepat, bukan? Anda bisa bayangkan betapa praktisnya Eleclean. Sebagai tambahan, tidak ada zat adiktif pada air yang dapat menghilangkan resiko yang dapat disebabkan pada sanitizer umumnya. Produk tanpa zat adiktif kimia ini tidak akan membahayakan tubuh Anda. Produk ini juga ekonomis. Jadi, siapa saja yang cocok menggunakan Eleclean? Dokter di rumah sakit, klien hotel, koki di restoran, guru di sekolah, pemadam kebakaran, pebisnis, nenek tua yang tinggal di sebelah, wanita cantik, hewan peliharaan, atau bayi yang baru lahir. Jawaban yang tepat adalah semua orang membutuhkannya. Kami memiliki rujukan ilmiah yang akurat serta grup peneliti yang ahli untuk mendukung kami. Sedangkan mengenai efek sterilisasinya, kami juga didukung oleh beragam sertifikasi. Selama Anda membutuhkan sterilisasi, semprotkan disinfektan Eleclean dapat menggantikan sebagian besar produk disinfektan yang ada di pasaran. Intinya adalah produk ini lebih aman, lebih efektif, ekonomis, dan praktis. Kami persilahkan kepada Anda untuk merasakan sendiri pengalaman terobosan baru ini. Eleclean semprotan disinfektan, semua bersih, semua aman untuk hidup Anda.
IMEdTech transforms healthcare through AIoT, combining our in-depth knowledge of hospital needs and years of experience of IoMT. We focus on enabling hospitals, care centers, and even individuals to improve their efficiency, optimize operation, and even decrease human errors. Let's look at some of our innovative solutions, shall we? For example, as we gradually move towards paperless hospital, we bring to the vertical market an e-paper display for clinical application. This wall bedside e-paper card is connected to the cloud, linking with your EMR, meaning you can review information that's crucial in your workflow, whilst enhancing patient satisfaction by offering uninterrupted sleep and ease of communication with your inpatients. It's energy saving, less tiring on your eyes, always on, and most importantly, HIPAA compliant. Let's look at the other example. It is known that falls in the elderly are a serious topic. Fall monitoring system is our non-wearable innovation in remote monitoring. Our solution answers exactly to the needs of the aged society to reduce fall and hospitalization whilst protecting patient privacy. All thanks to the marriage of AI and IoT, with the care needs at our core. There are a lot more. Automated dispensing cabinet, smart vital signs station. There's hardly an end to our solution lineup. As a tireless integrator of ICT resources in Taiwan, with the expertise in applying them to healthcare, we, IMEDTech, are your ideal partner in smart healthcare.
Di saat seperti ini, imunitas tubuh itu penting banget. Tapi kadang kita lupa, ada yang nggak kalah penting, yaitu kesehatan dan imunitas kulit. Karena kulit adalah garda terdepan perlindungan tubuh dari ancaman luar. Padahal ada makhluk yang tak kasat mata yang menjaga kita dari ancaman luar, yaitu microbiome. Wait, what? Microbiome. Mereka adalah kumpulan mikroorganisme yang terdiri dari jamur, bakteri, virus, dan archaea yang hidup bareng kita juga loh. Variasi dan keseimbangannya juga berperan membentuk imunitas badan kita. Nggak kelihatan sih, tapi mereka ada di berbagai organ tubuh, seperti sistem pencernaan, lidah, kulit, semuanya deh. Bahkan menurut penelitian, 50% sel tubuh kita adalah microbiome. Lalu apa jadinya ya kalau microbiome kulit kita nggak seimbang? Terus gimana caranya ya supaya microbiome kulit kita seimbang? Makan makanan bernutrisi dan bervariasi, olahraga teratur, meminimalisir penggunaan antibiotik, dan selektif pilih ingredient skincare. Yang paling penting juga, cek kondisi microbiome kulit secara berkala dengan Nusantics Biome Scan. Pastikan kulit kamu sehat dan microbiome kulit kamu seimbang. Yuk cek profil microbiome kulit pertama di Indonesia dengan Nusantics Biome Scan.
Leonardo da Vinci, legendary scholar, artist, and inventor. Could he have imagined modern technology running his inventions on a single device? Every day at ECS, we work on a dream to integrate business departments and offer single-stop technology solutions, bringing boundless mobile possibilities, bleeding-edge smart and IoT solutions, and stunning multimedia entertainment to people's lives in the world. Based in Taiwan, with its eyes to the world, ECS provides comprehensive services across major global cities. 3 decades of technology experience, strong financials, a talented workforce, and a constant drive for innovation and design give ECS a solid lead in a competitive global landscape, receiving international recognition and building deeper customer relations. World-leading equipment and capabilities at ECS's Shenzhen plant provide a manufacturing backbone for motherboards, tablets, laptops, mini-computers, IoT devices, and more. With large investments in our Thailand location, we push the envelope in R&D, manufacturing, and quality control, providing better services to customers worldwide. Integrating 4 business divisions, ECS stays true to its mission, bringing the future within reach. From this same desire, Levo was born, creating breathing space in work environments. Precision computer components are crucial to new technologies. At ECS, we produce independently and as part of major supply chains. In a world of speed, 5G technology stands to redefine fast. Artificial intelligence changes our lives, bringing smart cities closer into reach. New visual realities surround us. Digital displays expand possibilities. Stores can be more. Screens can be more. Controlling access more intelligently, ECS makes your ambitions safer and smarter. In an era of smart solutions, there are better ways to study. With an eye for a greener future, complete smart resource management solutions make the workplace greener and smarter. Time is precious, yet Earth's resources are finite. With cleaner transportation, we can all contribute. As industries navigate volatile markets, ECS helps businesses achieve distribution with fewer hands and more efficiency. Agriculture closely impacts the environment. ECS's unique agricultural solutions help produce food more ecologically, feeding the future more efficiently. Our advanced cloud architecture is the foundation from which we build. As the web connects everything, it brings together technology and humanity. We help you care for the Earth by making smart more simple, preparing you for the world of tomorrow.